Sebastian, it capped right at 100. Is that coincident, or is we aren't capped at 100, are we?
Actually, looking now, I think we have until the end of the month, but I'm going to double check on that and see if I can get it increased.
Okay, it's climbing. For those in the public, we're waiting for the attendee side of the webinar to top out. Right now, we're continuing to rise. So wait till everybody we think is going to be on is on, then we'll open the meeting. Okay, it seems to have plateaued there at about 182 attendees, which is great. So with that, we'll open this meeting of the Montoursville Area School District Board of Directors on this Tuesday, October 27th at 7:15 p.m. This is a work session, but it's also a session where there will be some agenda items. We'll have a period for public comment initially on the agenda items only. Then there will be a public comment section at the end for any items in particular, whatever the public wants to comment on. As far as the order tonight, well, I guess with that, after Brandy takes a roll call, we'll go into a couple of items before we get into the agenda. So Brandy, would you take a roll?
Mr. Albert.
Here.
Gary.
Here.
Mr. Kunkel.
Here.
Mrs. Marriott.
Here.
Dr. Mathers.
Here.
Mr. Ruffing,
Here.
Mr. Schimmel,
Here,
Mr. Snell,
Here.
Mr. Ulmer.
Mr. Ulmer here.
okay, with that, we'll move to the next item, the presentation. And at this time, the superintendent will walk the public through the process of making determinations on how and when and why you would, close a building, what goes into that elaborate process, frankly. And so with that, Christina, if you could walk us through that.
Sure. Sebastian, could you please do me a favor and put the chart up from the Pennsylvania Department of Education? Thank you. We've spoken about this chart in the past at our board meetings, and we'll continue to do so that it helps present what we're doing and what we are following. This is a chart that is on the Pennsylvania Department of Education's website. And you will notice that it is dealing specifically with when is it appropriate to be closing a school building. And you'll see that there are horizontal layers to this as well as there are vertical layers. And we can relate to this chart because in Lycoming County, we are in a moderate phase right now with a number of COVID cases that we have. And then on the vertical platform, you will see that it makes the recommendations for what to do when there is one student or staff member who has tested positive for COVID and has become a case. And then you can see that there are then two other layers to this process. And this process, again, was put together by the Pennsylvania Department of Education, as well as the Pennsylvania Department of Health. And these are the parameters that we are using when we are closing school buildings. At the last meeting, I spoke briefly about this and shared the chart, or maybe I didn't get to share the chart, but we did speak about how we would go about determining that and gave everybody the heads up of what we would be using. And this is what would happen. So for example, when we have COVID cases happening within the building, or a building within the district, I should say, we make phone calls out to the Department of Health, and we use what's known as a rapid response team. That rapid response team gets us into the Department of Health locally and then into the Department of Health in the Harrisburg area. They walk us through contact tracing, because that is something that we have to do locally, as well as they have to then do at the state level. They determine whether we can say excluding students or whether we can say quarantining students, because there is a difference. Quarantining is basically official Department of Health statements. A quarantine can only come from the Department of Health. And exclusion is what they make as a recommendation to us if we have close contacts within a building. So when we have to call parents and say your child needs to be excluded due to being a close contact of a COVID case, a positive COVID case, this is what we mean. What will then be the follow-up for that set of parents who have a student who has come into close contact with a COVID case is that the Department of Health will then call and speak with the family, and then they will also offer that it is a quarantine. A quarantine is then, it becomes official when Dr. Levine, who is the Secretary of Health for the state, sends a letter and lets the parents and the student know that they have been quarantined. These charts are created, as I have stated, by the professionals who are at the Pennsylvania Department of Ed in conjunction with the medical professionals at the Department of Health. So these are the only pieces of information really that schools have to use when making the considerations to close buildings. And you can see that in the number 2, it says 2 to 4 students or up to 5% of the population within the building. And then when you look, you would want to also use the horizontal platforms for moderate. And in speaking with the Department of Health today in our specific situation, and I can speak to no other school districts, I can only speak to our situation. When we were speaking today, the representative from the Department of Health walked us through this particular chart, made sure that we understood that we were now in the vertical axis of 2 to 4 students up to 5% of the population in the high school. And then they made sure that we understood we were on the horizontal axis of understanding that we were in moderate and that we should make decisions accordingly with this chart. So that is how that piece of this works. Activities work a little bit differently because activities run by policy. So when we, for example, when we would get out of school early or we would have snow days, those would be days that we would be missing and we would be closed, for example. Under having something that is a remote action, you would be putting students together during the time frames that you can see here is the 5 to 7 days. And that was not recommended to us to put students together under the 5 to 7 days. Again, I just want to stop and say, we are not medical health professionals. We are educators. We are educators for every student that we have. So we are using the charts provided to us through these 2 state organizations. If we look at the athletes under this guise, there are specific platforms where we have to certify that our teams are COVID-free. And those are certifications that everybody would have to sign off, and we have to present that with any teams that we are playing ahead of time. I'm not sure, Mr. Taormina, if you want to touch on that briefly, as you are the rep for that part of what we're talking about, or would you like me to continue?
You can continue.
Okay. We would have to certify that our teams are COVID-free and present that out to the other teams. And then a decision could be made as to whether or not games could be played. At this point in time, again, we are educators. We are not medical professionals. We cannot certify in good conscience that there is not COVID within our teams. So those are the pieces of rationale that we have used to make the determinations that were presented today. So we'll open it up for any questions. Sebastian, thank you.
Board, any questions you'd like to ask the superintendent? Well,
Christina, go ahead, Dave.
That criteria also takes into account the quantity of contacts that have been determined to be so close contacts. And if is it conceivable that if the contacts were a very low number, even though you might be looking at one of those numbers in the columns, it might be a mitigating factor for acting the way the column would suggest?
That is true, because in every case that you would have, your level of close contacts could be very few, up to 100, up to more than 100. So those are also considerations when we're looking at having school. How many of those students have been declared close contacts? And then how many of those students who were close contacts could not play a sport or be part of an extracurricular activity either?
Christina
Yes.
and Dan, this is Scott. So if we would play, do we have to certify basically the students that in this case are close contacts, or do we have to certify everyone on the team?
We have to certify those that are attending the event.
Okay. Thank you.
Christina, I have a couple questions. First of all, am I correct in saying that these this chart from the CDC is a guideline and it's a recommendation? It's not a it's actually not a one size fits all, but it's a recommendation from the CDC. Am I correct in saying that?
It's not from the CDC, Ron. It is from the Department of Ed. It's from the Pennsylvania Department of Ed. It's from the Pennsylvania Department of Health. It is the recommendations because they always say that local control matters in these cases. It is the only guidance that we have as districts, as school districts across the state. I think that what we're all missing and what we've all squawked about and really would like to have is the rapid testing. If we had rapid testing within our area that we were supposed to have, then we certainly would not be facing a lot of what we're facing currently, and nor would any other district do that. We would do more of what the universities and what professional sports teams do. We would be using that rapid testing and allowing students to continue their activities. But that is not available to us. And the unfortunate truth is that we still have people who refuse to do any of the testing in our community. So
I agree with you on the rapid testing. I think I've stated that before, that it's available, and I think it's ridiculous that everybody that's tested can't get the rapid testing. The recommendations, go ahead.
I'm sorry, to answer your recommendation question, Ron, I think the chart ranges. So when you look at that chart, it ranges basically for us from 2 to 30 students. And it's saying when you have 2 to 30 cases, this is really what you should be doing. I think that's why they have made those ranges a little more broad, so that you can give the Philadelphias, the Reddings, and other districts who are much larger than us the flexibility of not being out constantly, because they would understand that those districts have upwards of 20,000, 30,000 students, and rather than just our 2,000 students.
And because of these recommendations, saying that 2 to 30, which 30 would be the amount of 5% of our students in the high school. Where did the decision come from to shut down the high school with 2 cases? When actually the recommendation says 2 to 30.
Again, we've hit that qualification when the Department of Health spoke with me. That was the qualification that says, they asked, do you understand what this chart is showing you? Do you understand the linear versus the horizontal axis? Do you understand that Lycoming is in moderate? And I said, yes. Do you understand that this is the recommendation of what you should be doing for your building? Yes, it is. I understand that.
That's all I have for right now.
All right, Mrs. Bason.
Yes, Bill.
So obviously the key word is recommendation. Since these numbers and percentages are across the board and across the state, and they do emphasize local control. My first question is, it would be my suggestion that we make our own decision on this, rather than have that decision come out of Harrisburg and put us on the same guidelines as Berks, Bucks, Allegheny counties, big counties. And also, and I'm sure that we'll be discussing that more in depth. And also regarding, a more pressing issue coming this Friday night, the football game. The 17 players is the number that we have heard that have been in close contact. What would be if those 17 players did not attend the game? And could we, verify that the other players were not amongst them and not present for that game? And could we even play that game? And certainly that's a question for Coach Peipher, would be able to answer that question. Mr. Taormina may want to weigh in on that, but I'm just curious as to if those 17 players did not attend the game, would it be doable? Thank you.
So I can answer some of that because these conversations have been had as we looked at every possibility to have them and play this game. The Montoursville area high schools Warriors will show up anytime, any place, and anywhere to play a game with whatever kids we have that show up. So the answer to your question is, can we show up and play with the kids that we have remaining? Absolutely, yes. The issue becomes the 17 that are out now and excluded from school or at practices with the rest of the team. We have an expanded number coming because of the positive case today, where additional members will be excluded from school. So now we're approaching a little over 20 players that have been interacting last week and Monday. So I'm not sure who has it or who doesn't at this point in our building and in our programs. And to certify that we're symptom-free, COVID-free would be difficult. And again, without testing and the availability of testing, I don't know how we pull that off.
All right,
So
thank you, Mr.
that answers your
Taormina.
question. Yep, I hope that answers your
And then
question.
I have a question for our solicitor. What would we put ourselves at risk legally if we sent our team to another school and it didn't go well? Players from the other team were infected. What would be the legal liability or risk in that? If you could answer that, Tom, thank you.
Well, as Fred and I have suggested and stated before, you can't necessarily quantify or put a number on that. There's always going to be that risk that if there has been exposure and that certain members of the team may have been exposed, then of course, without testing to know who actually has it or who doesn't, and then going to play a game and then possibly exposing not only other members of the team, but also, an outside team of players as well, that of course, raises potential liability issues. What those liability issues might be beyond just contracting COVID, it's tough to say, but there's always going to be that risk there. Unfortunately, it's just not something you could realistically quantify just because we're working with minimal information, and that's kind of where we're at right now.
May I
Thank
also
you.
add that this is more than just football. The girls soccer program had an important game Friday. Cross country was heading to districts, and coming back off of this, tennis is heading to states. So this isn't just a football discussion. This is a heartbreaking and painful thing for many student athletes in our building right now.
Thank you, Mr. Taormina. And I was going to get to those other sports. In no way did I want to minimize them. And does anybody know how those other teams are affected as far as infected players go? Do we have any numbers on those other teams? Would we be safer if they could continue their season?
I believe I have 3 to 4 lady soccer players, and then cross country, I'm not aware of any at this point.
To go
Mr.
back
Chair.
1 second, Brandy, didn't we also have the insurance company weigh in on this for us a while ago?
Yeah, they provided a response that I forwarded to you.
And we provided that to the board, correct? Yes.
I believe you did.
Mr. Taormina, I have a couple questions. First of all, I just want to state that my biggest concern isn't the sports, it's the education that our students are going to be missing. But I do feel that the sports is important also. My question is, up until this point, all these sports that we have played since the beginning of the school year, soccer, football, cross country, tennis, all these sports, has certification been required from the schools we've played, and have we been required to certify to them also?
Yes, this has occurred all regular season through a PHAC form. The Pennsylvania Heartland Athletic Conference went down to just league games, and we certified within the league. District 4 also has a certification process in their own particular form, which is what we're entering. We're entering the District 4 playoffs this Friday and Saturday. The difference at that time during the school year and the regular season, we did not have positive cases in the district. The difference this time, District 4, as we enter those playoffs, the school has 2 positive cases and multiple direct contacts, some of which are on those athletic teams. So it is a different situation because our circumstances are very different compared to when we were in the regular season.
I have to agree with a statement Christina said that let's face it, you're educators, you're not healthcare professionals. How can you be expected to certify that our teams, depending on, no matter what sport it is, how can you be expected to certify that they don't, there isn't a carrier in our teams?
Yeah, we certify the symptoms and we certify the contacts. We don't necessarily certify COVID-free, and we couldn't possibly do that without testing. A lot of cases, a lot of COVID positive cases in kids are symptom free. So there could be 30 of them walking our hallways right now, or earlier in the day, I should say, and we'd have no idea. But testing would give us some idea. So I guess I hope that answers your question.
It helps. It does help.
If we can't certify, does District 4 then essentially say, well, you don't certify, you don't play?
Correct. And I'm not sure with how public our situation is, whether another team would be willing to play us at this point. Because then that risks, if they start popping up with cases, that risks their situation as well.
One other thing that just popped into my head, if the school is shut down, you can certify all you want, but if they're not going to school, they can't play in sports. Aren't I? Well, am I correct?
As you know, I've worked every angle through this entire process to try to make things happen for kids, going all the way back to last year's award ceremony and graduation when we were closed. Technically, we're remote. We're still in session. So right. That policy doesn't apply, and I don't think we can sit here and hide behind that policy. And I'm not hiding. I'm looking at it as a public health concern. We're either following guidelines and policy or not. And that's my role as high school principal. I'm not charged with veering from guidelines and board policy when I feel like it's the right thing to do. The right thing to do is stay in school and play these games. I'm with everybody, all 285 people that are here, all 9 of you, everybody in this meeting. I think people that know me and have seen the job that I've done for this district know that that's what I want. I looked at every possible way to make this happen, but I can't make sense of having 20 kids out because of direct contact with a positive case on a team to set them up to play against another school and risk spread of this thing and shutting us all down for extended periods of time. Kids were more upset today leaving, having to go remote than they were in March, because this time they knew it was coming. They were angry, and I'm upset, but there's not much I can do about it now. I have to follow the guidelines I'm presented. I have to follow the policy that's passed by the board, and my certificate lies with the Department of Education, not with the Montoursville Area School District. So I have to do some protection of that too for me and my family and my career. So I am in a lose-lose situation from all the way around, and I hate it. I want to do everything for the kids, and I just don't know how to get around it at this point. If you guys tell me to, we'll try it. You know, I will put every effort forward, but this is where we're at.
And I understand where you're coming from, Dan. We need to get them students back in that classroom. And by doing so, we wouldn't be going against the recommendations of 2 to 30 students, or, well, I take that back, 2 to 30 students and faculty, or the less than 5%.
But when you talk to DOH,
Yeah,
this is their recommendation. This is their recommendation.
And following the recommendations and closing the school for 5 to 7 days will hopefully help to minimize the spread of the positive cases that are there. It's not just 2 to 3 cases. It's all those 100+ potential contacts that could be carrying it around and then spreading it. And it takes a week to get a result unless you go find a rapid test and you get tested in the appropriate time frame. Because if you're a close contact and you get tested right away, it could be a false negative, because it takes a couple days for you to be able to test positive. So I support our superintendent and our administrative team on following the Department of Health and Department of Education guidelines. We can't work on emotions. We want our kids there. We want our kids playing. My heart aches for them being pulled out and not being able to play these games. But I don't know that we can let those emotions make our decisions. I think we need to stick to the recommendations from those who know what they're doing in the Department of Health.
And Dr. Mathers, I certainly see your point. I think Mrs. Bason, as always, has acted in the best interest and the health and welfare of our students. But I think there comes a time that I think the right thing to do, and we can get into this later after public comment. We hear public comment and what they want and what they think. After all, we are representatives of those who elected us. I think that the right thing to do is to take this burden that has been dumped in the lap of our superintendent, who certainly doesn't like to have to make these kinds of decisions either, even with her administrative team. With all due respect to Mrs. Bason, she was not elected by the taxpayers to represent them. We were. And I think that it is fair to the taxpayers that we do our job and represent them. And I think it's fair to Mrs. Bason that this burdensome decision is taken out of her lap and put on the board. And I'm sure that that we'll have further discussion on that as the meeting progresses. Thank you.
Just to piggyback on what Bill had said, it is the board's responsibility. We do represent this community. And when I can appreciate what they have to do and what their jobs entail, I, on the other hand, agree with you, Bill, that it is the board's decision. When you discuss and you talk about up to 30 people and what's happening, we have 2 or 3 cases. And as far as other districts go, they're no different than us. We're all in this and nobody else is doing it. And, you know, I know it is about the, all these students. Well, athletes are students too. And it's disheartening to see where we're at right now. When you look at the recovery rates, the 99.6% of students and children that walk away from this with nothing, it's hard for me to swallow the idea of taking so many dreams and opportunities away from so many young people right now. And that breaks my heart just the same. So that's all I got.
Well, Danny, we actually kind of have 2 issues, though. We've got the school closing, and that's sort of on a separate track. And then we have the sports issue with that all-important certification, and that's kind of on a separate track too. So there's a little bit of overlap, but we actually are wrestling with 2 different issues here tonight. So, board, any more questions or discussion? I'm going to propose that we just, we'll make later add an agenda item regarding if there's additional deliberation on refining criteria for closings, something that helps maybe reduce the burden on administration, or something that maybe reflects more like what we think is closer to where we are as a district, not wandering outside, guidelines per se, but just refining, because there's a pretty big window in here in the guidance I think we can work with. So later on, I'm going to recommend we have an agenda item regarding closings, and it may come to some kind of a motion, and it may not. Additionally, for the public, we're going to be discussing, there'll be an agenda item added later on too regarding the board meetings, whether we are going to do in-person meetings or continue with virtual meetings, and how the board wants to navigate those waters too. So that'll be an agenda item added later. And I mentioned that now so that if the public wants to comment on that item, they can anticipate that it will become an agenda item later on. So you can comment now on that. When the board discusses it later, of course, the board will have its opportunity to comment and discuss that in-person versus virtual. But for the public, for your sake, now would be a good time as we're about ready to move to public comment section of the evening. So those 2 additional items, a policy refining criteria or policy or decisions on when we close, see if there's some refinement can be made there. And then the in-person versus virtual school board meetings. So with that, board, anything?
Mr. Schimmel?
Yes.
Now would probably be a good time to announce that we did have an executive session before the meeting. That way you get out of the way.
Yeah, thank you, Ron. Yeah, we had a brief executive session for safety, security, and some legal advisement. So, okay, board, if you're ready to move to the public comment section, we'll do that. And Sebastian, go ahead and open the gates and let the public comment, and I'll help keep track of I guess the pecking order, and try to help you out, Sebastian.
Okay, so at this time, if anyone from the public would like to comment, you may do so by clicking on the hand icon on your screen. And once we start seeing some hands pop up, which we already do, we will go down the list alphabetically and allow you to speak one at a time. We will offer 3 minutes for comment each, and we just ask that you please state your full name and address before doing so. Okay, so at this time, I'm going to start with Dan.
Hello, can you hear me?
Yes, we can.
Thank you. A couple things I'll go through here and then let you guys respond. First of all, I appreciate a proactive response from a scientific approach. Granted, I also agree that emotions can't speak for science, and it sucks all the way around. Me being a former coach myself, I totally get it. And sports has a huge impact on mental health of athletes. And it is a great benefit to those who find their community and fitting in within sports. I can't disagree with that at all. It's 100% important. Second, also, we are in an area where we're kind of sheltered from the larger impacts of COVID and what it has done to other parts of our state, along with other parts of our country. At the same time, we are seeing an uptick, period. That's kind of how things are moving right now. I've also have seen in other school districts, and I don't know for what exactly is happening with all contact tracing with kids, to where kids and faculty who have been within the PA Department of Health guidelines and CDC guidelines of considering those who need to be quarantined and moved into quarantine and keeping it isolated to just those individuals rather than applying it to a large group as a whole. There's been pros and cons of each way of looking at that. And as far as I listened to one comment earlier about it doesn't really impact younger populations of people. Agreed. Science shows that it's not having as major of an impact. But that kid who gets it goes home to a parent who might have diabetes, or a student in school who might have asthma. It's not necessarily, this disease isn't about the individual themselves, it's about those others around them. And I think as humans, we need to take that into consideration, that it's about looking out for our neighbor. It's about looking out for our community member. That's who we need to be looking at for. I go to Sheets here in Loyalsock area. I see at least 7 kids from the football team walk into Sheets without a mask on. When on the door it says, hey, throw a mask on if you're going to come in here. That shows a disregard for the science. I'm sorry, but I knew the Montoursville players. It's not cool. Like, I take my stance pretty seriously as far as if the scientists are telling me throw a mask on, it's not going to hurt anybody. It's not about the self-ego. It's about helping the common person next to you. That's what this is about. And unfortunately, I've seen this occur within Montoursville. That's a community, that's a cultural thing. That's something that we as a community, you as a school board, should really be preaching to all of your constituents who vote you in. Hey, throw a mask on. It's not going to hurt you to have a mask on. So I think it's at some point that needs to be taken care of. On the other part, as far as public school board meetings, if you guys want to go in person, I don't really care, as long as things are kept virtual also, so that those who do not want to come to attend in person still have the option to voice what we would like to voice through this method. That's all. Thank you.
Okay, continuing down the list, I see Keith Bennett.
Hello, everyone. Can you hear me?
Yes,
We can hear you.
This is Keith Bennett, 1479 Quaker State Road in Fairfield Township. First of all, I just wanted to, I want to express, I have the utmost respect for all of you guys. I mean, you guys have a tough job in these times, and you've done the work. I had emailed all of you with the impact this has on our two student athletes. I come from a logical, common sense background, and everything that was put in place midsummer to get our kids back on the practice fields. We've been following those guidelines to the letter with zero issues. It's gotten them through their regular season, and to have this all come crashing down with one decision is just unacceptable. I mean, I urge you all to think long and hard about this decision. I know the safety of all the students are utmost important, but this is devastating for the kids. Please just reconsider this decision and let our kids get back on the field here this week. Thank you.
Thank you.
Okay, moving down the list.
Hi, this is Kaye Blair. Can you hear me?
Yes, we can.
Okay, my one question I have, well, it's a little bit extended too, is I understand that you have COVID things in the high school. How many of those COVID kids in the high school are getting on a bus and riding throughout the district with other students in part of your contact thing? I have grandchildren that have asthma.
None. I can cut you off right there. I don't mean to be rude, but that is part of contact tracing for us. None.
So there's been none that's ridden the buses.
That's correct.
Okay, okay. Now, is it in question this football game on Friday with Loyalsock? Is that what they're upset about?
Yes, ma'am.
Okay, all right. That's all I had, Christina. Thank you.
You're welcome.
Okay, next on the list, I see Tracy Bower.
Hi, can everyone hear me?
We can.
Yes, we
All right. My name is Tracy Bower. I'm at 22 South Montour Street here right in the middle of town. My son is a student at the middle school. First of all, I would just like to say, I know it's a really trying time right now for the entire district, especially our board and the role that our board, our administrators, and our faculty have been burdened with during this whole pandemic. I understand how difficult that has to be for everyone. And I appreciate that you guys take this as seriously as you do and try to make the best decisions possible for our students and their safety. I do have a question specifically about the chart that you showed at the very beginning of all of this. It did state there in that second section going across that multiple school buildings with individual cases who are not household contacts. Out of curiosity, are the middle school student that we have that's currently positive and one of the high school students household contacts? Because if that's not the case, should not the middle school also be closing at this point?
What I can share with you is that we have followed the rules to the letter, and I cannot share cases individually with anyone.
Okay, so I guess gleaning from that, that if those students are not household contacts, then the middle school would be shutting down as well.
I can only reiterate what I have just shared. I apologize, but I would never put someone's confidentiality at risk.
Okay. Well, the only concern that I have as a parent and I'm sure that a lot of other parents have this same concern, is if we're unable to know even mild specifics of what's going on, how can we ensure that our students, our children, who may or may not be high risk, such as my son, are not coming into contact with these kids?
We do our very best to make sure that everyone has their mask, has their gaiter, has their face shield, uses them appropriately for the time that they are with us. If I knew that those times were the only times that students would be out and about, I could guarantee you that. I can't guarantee you that because we all go home and we all go into different types of households and friends' houses and all of those other components. So I don't think that I could ever, in good conscience, ever say to you that that's going to be a 100% risk-free situation. However, what we can say is, so far, our parents, our students, our staff have all been very aware and sharing things with us so that we know if there's any kind of issue, we are on it. We are with the Department of Health immediately so that we are not putting anyone else at risk. And that's why we do follow all of the processes that they have out there. We want to be in school long-term, not here and there. We want everybody back 180 days. And that's why we do have to help one another out with this.
All right, that's understandable. The only other question that I have is more of a suggestion. I know that some of the students, especially our high-risk students that are unable to attend for whatever reasons, my son recently just went back and we had just started back to the full-time model, which we were doing really well up until this point, in which, we have had these positive cases within the district. A suggestion that I would like to throw out there is I think that we should be able to make the remote option available for parents and our high-risk children and any children that parents would like to keep home in the case of something like this happening, to make it easier for not only our peace of mind, but also the protection that we can offer, the level of protection we can offer to our children.
Thank you.
And that's all I have. Thank you.
Okay, continuing down the list, we have Sarah. Sarah, if you're there, you should be able to unmute yourself using the button on your screen. Okay, I'm going to move on and put your hand down, but if you'd like to put it back up, you may do so at any time. And continuing down the list, we have Alaska.
Can everyone hear me?
Yes, we can.
Okay, I'm calling Dreese, 84 Ingle Run Drive. I live out in Barbers. I have a couple questions. As I already know, there's a couple cases at the high school. I have one child at the high school and two at the middle school. And my child, well, he rides the bus, and then we get told that we have to pick him up due to he was in close proximity. Well, what about the rest of the children that rode that bus? And also, what about my children, my other two children that are riding the bus and they go to school? What's going to happen there? Is there something that's going to be done about that?
We would not be able to comment on any student or any staff. You can call your principals and we can talk about that, but we could not discuss that publicly. That would be violating confidentiality of students or staff.
So my child's and other children that are on this school bus,
There are
Say
no
my
school
son or
buses.
any other child on that bus.
There are no school buses
There's
involved.
technically,
I'm sorry, go ahead.
yes, there are. There are school buses involved, considering there are several kids in my area that I live that was in close proximity of the children that were at the high school. And they rode the bus yesterday. All of them did. So you're saying that they're allowed to ride the bus home, but then again, now they're going to be quarantined. Okay, they rode the bus home, but what about all those children on the bus? They don't just go to one school. They go to 3 different schools. Sometimes, actually, no, my kids all go to Loyalsock Elementary. So they'd go to Loyalsock, the middle school, the high school. What about those children?
If there is
Can I
contact
ask-
tracing that needs, go ahead, Dottie. Sorry.
I think you're concerned about what you're talking about is a contact of a contact. And according to CDC, those contacts of a contacts do not need tested, nor do they need quarantined. Only those that are in close contact with a positive case. So those that are in contact of a positive case are down the line that they don't have to quarantine or get tested unless they become symptomatic. Does that help? That did a little bit, yes. I appreciate that answer. That was extremely more helpful. I think that was my main concern, and I appreciate your time. And I thank you for responding to that. I appreciated that. Also, I'm sorry, one more thing. For the parents that aren't receiving emails or phone calls, what's going on with that? I didn't get any email regarding any of the COVID information, and I have yet to receive any phone calls. Is there a reason that I'm not getting them when you guys have all my information?
Yeah, I would verify your information in the parent notification system, and you can call the administrative office and talk to Diana McElwee.
I did
Yeah,
make sure all my information on the portal was correct.
I'll give you a call tomorrow. It's something I need to do because the system's showing that you received the email and that the number was disconnected. So I will touch base with you tomorrow to let you know what information we have in the parent notification system and then update that to be sure that you get those. So, but it is showing an email was delivered. I just don't know what email address off the top of my head.
It's okay. Thank you. I appreciate it, everybody. And hopefully everything continues to go well tonight.
Thank you.
Okay, continuing down the list, we have Vic.
Hello, you hear me?
Yes, we can.
We can hear you, Vic.
Thank you. Vic Gorini, 1111 Franklin Street, Montoursville. My day job is working for the district as a school social worker, and I'm the mental health liaison. So I thank all of you for everything you do. And certainly I see Mr. Taormina and everybody, working their behinds off every day for the students. I guess I guess what I want to say this evening is, I moonlight as the girls soccer coach, especially, and that's part of why I'm speaking here tonight. I guess I would just encourage the board to relook at those guidelines to say, can we moderate the days that the school's going to be closed? Does it make any sense to close one school and still hold indoor sports in another? Do we have anything to accomplish with a 7-day closing period? It's not going to cover a quarantine period. And I say specifically to my sport, I met with my 40 players today. They were devastated. As someone who does mental health services, I'm very concerned about that issue, about that factor where sometimes we're taking away what is a considerable mental health support for the kids. Sometimes it's their only outlet, their only guidance, their only role model, the only direction they get in life. I sit here today, right now, I can't speak to, I heard Mr. T say before that maybe we have 3 or 4. Right now, from what I know, out of my 40 players, I have 1 that was caught up in the contact tracing, 1 more who has been excluded in quarantine due to a family member testing positive. So I sit here right now with 38 healthy players unable to compete this Friday, and something we've worked daily for since July. We have a very thorough screening process. The questions will indicate whether someone has been in contact with someone with COVID, whether they have any indications of symptoms of COVID. We sign off on that. We screen, they do the QR code, we sign off. It's safer. Our soccer program is safer than going to Walmart any day of the week. We're outside. I think the risk is low. To take this high end of the chart and make an action on it and not consider everything involved with it. And also, I guess I would ask if the district has any discretion at all. I sit here with a group of 38 to 40 young female athletes who have worked their butts off to get to where they are. And now we're caught up in a very broad-based shutdown and exclusion. You know, from where I sit, it looks as though there hasn't been a whole lot of individual discretion, and I understand fairness to all, but I would just ask that you look at that, look at the big picture. It's not just a sport, it really is a lifestyle. It's a support for the kids. The remote learning is another matter. I'm the one that goes out to the homes and knocks on the doors and tries to track people down that we haven't heard from when we go remote. There hasn't been anything positive about that, and I understand it's a tough call. But I guess when it comes to the athletic part, I would like anything at all the school could do, the school board could do to use discretionary measures and allow us the opportunity to compete. I sit here with 30, you know, if I take Mr. Taormina's, that I have 3 or 4, that still leaves me with 36 healthy kids that they have nothing COVID related at all. They're not excluded, they're not quarantined, they're not identified. It makes no sense. It's hard to explain to them why they can't compete this weekend after such a long stretch of daily screenings and competitions and practices. And so I thank you for your consideration with all of it. And I just really like you to not minimize some of those things. Sports affect academics, no doubt about it. Some kids, that's the reason why they do well in school. And I just like to not have that taken lightly. So I thank you all for your time. I appreciate it.
Thank you, Vic.
I'd like to make a comment after Vic's comments there. I too am concerned about the mental health of our students, and not just our athletes. I'm concerned about the mental health of the students that are looking at going to college and making a good impression for those colleges that they wish to attend. And let's face it, at the end of last year, our students got behind. We need to let them catch up. And I think we need to think about the mental health of all our students, and not just the students, the mental health of those students' parents also.
Okay, continuing down the list, we have Phil and Kelly Young.
Hello, can you hear me?
Yes, we can.
All right, great. So first thing first is the easy one. I comment that I would appreciate if similar to what the comment the other person made, if you're going to decide to move the school board meetings to in person, that you also keep a virtual option. Obviously, you can see the number of folks that are in attendance tonight. I don't think you could safely accommodate that level of people just in person, and I wouldn't want anyone to be limited or eliminated from being able to take part in the discussions if they wanted to. Moving on to the in school and the athletics, I'm going to go back to what Mrs. Mathers said, Dr. Mathers, I'm sorry, and also what Mr. Taormina said earlier, that I just want to ask kind of a clarification question or point out, which is we should be looking at and talking about what the CDC or the health department deems as somebody who's been in close contact and needs to be quarantined. And I understand that there's only a couple cases. And I understand then that there's an additional number of people who have had close contact with them that are deemed that and need to quarantine. But I don't understand, or I don't think that it's unrealistic to certify the remaining people that are on the teams for any and all of these athletic teams that are more than 1 degree of separation away from someone who's been tested positive. There's been plenty of other situations around the district. There's a coach, there's multiple coaches in the district who've had to quarantine. Those coaches clearly were in contact with all their players. That did not prevent those districts from certifying their teams in order to be able to play. I don't think that there should be a problem, that we should feel uncomfortable being able to certify the teams with whatever warriors we can put out there to be able to go and play their games if they are not someone who's either tested positive or who has been officially deemed someone who's been in close contact and needs to quarantine. To say that there's some kids on the team that need to quarantine and therefore you got to worry about anyone else on the team is no different than what you just talked about the school bus, which is they're more than 1 degree of separation away. It should not be a problem. The other comment that I would like to make about in school is I agree definitely with the mental health comments that have been made. And I would also say, I think that it's clear from plenty of data out there that in school is the best option. I listened to the Williamsport school district meeting, and they talked about the number of kids that are falling behind because they haven't gone back to in person, and there's kids that check out. I can tell you that my son's grades are worse this first semester or this first marking period of his last year than they've been in any other year. And I attribute that to the fact that we started the school year in this hybrid mode, and it was more difficult for him in that than it is when we're in person. We take the precautions in class to separate kids, to have them wear masks, to use the shields. I would think that would be the best case scenario when you start worrying about whether you need to be concerned about close contact. I know that I go to work every day, and everybody that I work with all have to wear masks all day long unless we're in our office with the door closed. And the reason we do that is because if somebody should get it, we're not going to shut the entire factory down, because we're not considering anyone else to be in close contact, because any interaction that we have, we always make sure that we have the PPE on to keep ourselves protected. And that's the same thing that all of your students are doing. I think they're safer in school than they are when you send them home and you do remote learning, or when they're in their after school hours. The school is the safest place that they are for the largest majority of the time they're awake. So I just would ask that, like's been said before, I appreciate all of you and what you do. And I would love to see you take the burden off of the administrators, Mr. Taormina and Ms. Bason, and use some judgment to look at our situation, the things that we're doing, and what we can do to put our students in the school and our athletes in the competitions for any and all of those that have done everything they can to stay safe and to be ready to compete in these competitions. That's all.
Thank you.
Next on the list is Laura Denoon.
Hi, this is Lara Denoon, 23 Oak Lane, Montoursville. Good job, Philip Young, just want to say. I definitely agree with everything he just commented. My question was going back to an earlier statement at the beginning of the meeting. I wanted to know what is considered rapid testing in terms of turnaround time, and what are the barriers to that kind of testing for student athletes that might be needing to play in an immediate nature. I know that I've known several people who've been tested, who are told that it would take 2 to 3 days to get the results back and have been called within less than 12 hours, and that is locally here. So just wanted to know what's rapid testing and what are the barriers to getting our student athletes cleared.
There is no facility locally that would handle the volumes. Number one, I think that school districts would want them to have, not just for athletes, but for other types of extracurricular band, choral concerts, and other things too that I could think of, even having student meetings after school, having all kinds of volunteer programs and things. So I think that that's the first piece, but rapid testing is not available in Pennsylvania like it is in other states. And there is one locally that we know of that is a Geisinger facility that we can see something turning around in less than 24 hours or about 24 hours sometimes. And you're right, we have seen it turn around in 12 hours as well. We've also experienced doctors who will not do any kind of testing just because you are a school student. We've had them tell our staff that they will not test them just because they're exhibiting symptoms and that they are around hundreds of students. They will not test them. It seems to be an individual preference of whomever you are working with as your primary care provider or otherwise in a MedExpress situation.
Okay, thank you.
You are welcome.
Next on the list, we have Alex.
Hi, can you hear me?
You can.
Hi, my name is Alex Acrone. I'm 503 North Washington Street. I am a senior at Montoursville Area High School. And first of all, I just wanted to say that this is a really difficult position. And I'm really thankful for you guys being able to, follow the guidelines and do what you think is best for all of us. I just want to point out that, I see both sides of it. I work in an area where there's a lot of at-risk people, and I have family members that, I care about who, if they got this, it could be potentially fatal. But on the other hand, I qualified for state orchestra last year that was canceled. All my PMEA festivals, I play the flute, they're all online, not happening in person. So I completely understand the struggle. The thing is that we keep saying that students are wearing, personal protective equipment, school is the safest place. From what I'm noticing at the high school, that's not happening. People are putting their masks under their nose. People are just straight up putting their mask on their chins. The CDC has proven that those gaiters don't do anything along with the face shields. And I just, as somebody who's had their senior year doomed to start with, it frustrates me that isn't being more widespread, like enforced, that, you keep your mask under your chin, over your nose. I've only had one teacher that says, I'm telling you at the beginning of class. If I have to tell you during class, you're going straight to Mr. King's office. And as somebody who wants to have those opportunities back, it's just really, it's really frustrating to try to wrap my head around that. And, I'm in the marching band, and I was walking out of school today. I was getting my piccolo for the 7-day, while we're out of school. And I saw 2 football players. I have not seen these 2 football players exhibit any emotion until I saw them sobbing, because, and this is a direct effect of the actions of our students and even our teachers who are not taking the necessary precautions to keep everybody safe. Now, if we could get everybody, every parent, every student, every teacher, whenever they go into an establishment wearing a mask, we probably wouldn't be having this problem right now. And as a senior, I'm just really frustrated, and I'm just sick of this. I'm sick of seeing like my friends crying because their things were canceled. I'm sick of personally crying because, you know, everything that I love is being canceled and taken away right in front of me. You know, I just really think that, first of all, we need to get our heads on straight as far as this PPE. Like, if we're going to mandate masks, we have to mandate them. You know, there's no getting around it. That's why we're having this issue, is because students are putting them below their nose. You know, this virus isn't spread. It's not a hoax. It's here, obviously, and we need to treat it as such. And as a senior, I'm just kind of frustrated.
Alex,
And-
you
and
are
if I
wise
may-
beyond your years.
Thank you.
If I may, I can back up what she is saying. That's why Parent Link went out asking for parents' help with these masks. We have put it on the announcements. They do no good below the nose. And the problem with that is I'm doing it, so when they see me, it goes up. And then when I'm out of sight, it goes back down. So it has been very frustrating. And when we went back to 5 days, things started to feel very normal. Discipline started going up, and the masks started going down because things were feeling normal for everybody. So it is a constant battle. It might be mask fatigue setting in for a lot of people, a lot of our students. So it is a battle. And once again, I will plead with the public, plead with our parents. Please have conversations with your kids when you send them to school. It has to be on. It does no good below the nose. It does absolutely nothing below the chin. There is a study in one of the medical journals that says the path is through the nose. That is the greatest path of entry and exit. So again, I plead with everybody to please wear that mask while they're in the building when we return. Thank you.
And
And
while
thank
they're
you,
out in
Alex, for
public.
your
Yeah.
and thank you, Alex, for your honest comments. I feel your.
Thanks for hearing me.
And I want to thank Alex also, because you raise a really good point. If people are choosing not to follow the guidelines and things are canceled, the board isn't the bad guys for enforcing that. Those are the natural consequences of people not taking responsibility for following the guidelines. So let's just remind
Amen.
everyone who's making what choices here, and who's causing certain consequences to go into effect.
Alex, I'd like to thank you also for bringing that up, because I've had parents contact me that their student has come home telling them that they've been in classes where kids have not been keeping their mask on. In one class in particular, it was said that they have them. A number of kids have them below their chin, and you are right. That is absolutely not acceptable, and that's could be possibly one reason why we're having to have this discussion tonight. People need to follow the guidelines and wear the mask. Parents need to help us with stressing their students, their children, to wear the mask, and also not have parents pump their kids up with Tylenol and send them to school, and then at noon find out when the Tylenol wears off that they have a fever. We as a community need to work on this. We as a community need to come together and fight to knock this down.
Yeah, I just thank you for listening. Yeah, that's just basically all I have to say about that.
Okay, moving to the next hand on our list, we have Brenda Oberheim.
Hi, this is Brenda Oberheim, 192 Woodland Court. Can you hear me okay?
We can hear you, Brenda.
Okay. So this is about the meetings. And first of all, the last board meeting that was had, the turnout was not as good. How many people did we have at the meeting last time?
9, maybe?
Okay. So comparing this meeting, which, you know, there's a lot of important things that we need to discuss, obviously, and that meeting, if we look at those 2 nights, it all depends on what the topic is. So of course, due to COVID, we've had some pretty hot topics, and which gets you, you know, more of a turnout at the meetings. But we can't really say, oh, look at the Zoom meeting. It has this really great turnout because it's Zoom. So first of all, I wanted to say, I'm going to actually just read it so that I don't miss anything. We want in-person board meetings. Yes, the COVID situation has changed some things, but there is no reason the board should not meet in person with the parents. We definitely have more of the board's attention when we are in person. All the at-home distractions are not there in person, nor cell phones and texting. We can see them in your glasses, the phones, like the reflections. We don't want meetings rushed, nor parent comment time rushed. The Zoom option is fine for parents, but the superintendent and the elected board members should be in person representing the people that elected them. And why do you, the superintendent and the board, want to only go to Zoom meetings? Like, what is your purpose behind that?
Oh, I just thought that it wasn't possible to Zoom the public in terms of the equipment. My goal, I think someone said earlier, is that the most public attendance can be there. And I thought we couldn't remote people in if we were in person. And I didn't like the idea of turning people away at the door and saying when we hit this capacity and there's no remoting in for the audience. So am I wrong about that, or are we able to?
Tonight's capacity, we can never handle it, given the social distancing and that. There's just, we don't have our auditorium in the high school wouldn't work.
Right, and I understand that, but we're talking about, this was what isn't the discussion about making it a permanent thing where you guys never have to see us in person?
No, the next item is to do a hybrid, if you will, of both in person and then having it an interactive webinar combined with in person. We don't have the technology that will accomplish that. We can buy that technology and it's very dear. It's going to be easily north of $10,000 to do it in such a way that the public can interact with us at home as well as in the auditorium or wherever that in-person meeting is. And so that's been the hang up of you know, trying to accomplish both those. Now we can broadcast an in-person meeting, and depending on where it's broadcast from, it's probably, given our current equipment status, it's not going to be a very good audio and video feed to those that are watching online. It just, we don't have that equipment. We can get that. So that's really been the hang up at this point. And I've put a lot of thought into how we can accomplish that. And as the board president, I want to be in person too, but I don't want to like last meeting, 8 or 9 tonight, you know, there's 275 here. I don't want things to blow up for us. I want the public to be able to comment, because that's the primary purpose of a public meeting, is so the public can see what we're doing and has the opportunity to comment. And I don't want to get in the way of that. So however we accomplish that, that's what I want to do.
Right. So were you guys going to vote on this, or was this something that you guys just wanted put through without our input on? I'd like to understand how all that came about. Like, was it someone's, idea to go ahead and do that? Like, we want to be considered in these decisions, because I mean, obviously, like some of the things that I mentioned and what I read was saying, like, we want that accountability from you. We want you guys to meet in person. We don't want to continue on with this Zoom if we don't have to. We want to be able to face the people that are making the decisions for our kids. And so, yes, this is COVID, you know, it's a limited time thing, Lord willing, but we want to get back in person and not have to worry about that at all. So, I mean, I don't know if the school board's ready to spend $10,000 on that equipment. Maybe just getting us back in person as soon as possible would be the best thing, and let the others go.
But then
My
Brenda,
question would be-
you mean like shutting the door and cutting it off when the public attendance hit the point of the regulations of how
Right,
many
but
people can be
COVID is
inside?
a temporary thing. I mean, that sounds so scary when you say it like that. However, COVID is temporary.
I have to ask, our auditorium is a 900-seat auditorium. Has anybody figured out if we do social distancing in the auditorium, how many people that would accommodate?
Dan, what do you got?
The seats are almost 150, 148, 149. But then you have everybody else, board members and such that are attending. So you'd have to subtract that off.
Well, the board members would be up on the stage.
It doesn't matter. It's the capacity of that space. And that space is limited to 927.
And if it is okay,
that
whether
includes stage and seating area. So
if the
Brenda,
weather
I
is
don't think-
okay, we could
Brenda, I don't
probably,
think
if the weather is okay, we could probably go back to the stadium idea outside again. And
Brenda,
if COVID is still going on, then.
I don't think anybody has said this was going to be a permanent solution. I don't know a single board member that wants to go virtual permanently at all.
Oh, no.
That's very reassuring. I appreciate that.
Oh, no, not at all. Yeah, no, just literally in the next, what do we do in the next month or two while these limitations are in place?
Mr. Schimmel, where'd the $10,000 figure come from?
Well, Dan had got some pricing on some equipment, and he had showed that to Sebastian. And Sebastian, being a little more savvy than Dan on some things technical, said, Dan, there's no way you're going to get what you pay for it. And that equipment was like a 5,500, and Sebastian was adamant that will not do what you want it to do if you want to put that like in the auditorium and be able to pan with good video quality. And it's walking back and forth, looking at whoever's speaking. You're able to plumb the audio feed, from it into the sound system, and you're able to do it right. And the $5,500 system, Sebastian didn't feel we'd be regretting it.
Christina, couldn't that money be, funded through the CARES money?
No, the CARES money has already been designated and primarily about 98% spent, because it had to be spent by October the 30th for one of them and December the 31st for the other. So we looked at that. We tried doing that, Ron, so that we wouldn't have a large number of expenditures for that. And we might be able to squeeze about maybe $1,500 to $2,000 out, but it doesn't cover the rest of it at this point in time.
And then I would just add that the IU has a setup that would accommodate the full board to be able to do what we're doing currently, but not have public in attendance. They would be able to Zoom, and the quality would be what you would want for a meeting. So the IU would be an option for just the board to be together.
Well, that's no different than what we got right now, really.
No,
right.
No.
What about the county, the money coming from the county, Christina?
That money has also been, we had an application go in, and that application is also designated. That had to be done several months ago. So we already have those funds designated as well. I could certainly read the platform for that one and see if there would be any way that we could move something. However, we would have to really look at that because we've already designated it for things that we have within the district. So we certainly can look at that. I don't guarantee any results though, because I don't know what their parameters are in the grant. I do need to read if we can take something out and put something new in.
I'd also like to add as well, it's not just a problem of money. Yes, it would be very expensive, and I will say from experience working with multiple districts and implementing many systems like what we would need in this case, $10,000 is on the very, very low end of what it would cost. But just as I had emailed the board a few weeks ago, explaining the difficulties in obtaining technology such as Chromebooks and laptops, we're seeing the same issue when it comes to AV equipment. All of these cameras and microphones are in such high demand right now. It could be months before we would even get the equipment. And I don't know about you guys, but hopefully by then we won't need it. But that is another challenge that we're seeing right now as well.
Gosh, the only other thing I can think of is like, you think we could rent out like Homing's seminar, you know, the big room in the new Gateway Center, and they'd be happy to make a couple $100 for a meeting, and they already have the cameras installed. And I probably seating for at least 50 members of the community, socially distanced.
Does the IU have public seating capacity, Christina?
I don't know. I've never been there in that particular room. So I am not sure what they have capacities for. Sebastian, you would know that, having been an employee there.
Yeah, their biggest room in Williamsport, as far as a year ago when I had worked there, was still probably smaller than our boardroom.
That's why it would just be 4 board members is what backs up what Dan is saying.
That's what I would think.
Okay. And Nathan Miller is a board member for South Williamsport. He sent me a notice that it is no capacity. It would just be able to be the board only.
That's correct, Christina. There's no room there. There's really, as the IU rep, no, they don't. Our boardroom in the high school is actually bigger.
Okay.
Okay, Sebastian, let's continue on with public comment.
Okay, moving down the list, I have Joseph McKern. Joseph, are you there? Okay, hearing nothing, I'm going to lower your hand, but again, if you would like to speak, go ahead and throw it back up there. And we will move on to Matt Alexander.
Hi, Matt Alexander here, 110 North Loyalsock Avenue. I want to just first start with the Zoom meetings. I think they're great. You can actually see your faces and things like that. Some other school meetings, board meetings I've attended where it was kind of a virtual thing. It was just one camera and you couldn't see like the people's reactions and people's faces. Obviously the in-person is the best option, but until we can do that, you know, and have everybody there, I'm thinking the Zooms are a good substitute. My main question is, was there a plan to begin with? And what do I mean by that is, like, we closed down the high school because of 2 cases. Did the public know that? Because if so, I didn't know that. And if the public did know that, maybe, just maybe, they would have behaved differently. Like the students would be wearing their masks and things like that. I know there are other school districts that have a plan. That's when we get to this threshold, whether it be number of cases or a percentage of community spread or whatever it is, like they had a plan. I know one district's plan is like 120 some pages long. And so that is basically my main question. Like, did we know going into this that this was going to happen? Because if so, it shouldn't be a surprise to anybody that we're here where we are. I mean, we went 1 week and a day having full classes, and we have our first 2 cases, not 3 now, with one at the middle school. I don't know. That's all I need to say. I'll wait for your reply.
Sure, Matt, we can certainly respond to that. Yes, we did have a plan. That plan was approved, I wanted to say, in July. It is part of what you can see on our web documents. It is out there. And the plan was that you follow what the Department of Health recommends, and that was approved by the board twice now. We've actually had one plan, and then we had to revise it when we came back to full-time status. And when we did last month's meeting, and there were only 9 people there, we reviewed the plan again, and we went through all of the particular changes that were made within that document. And we read each of those. So you missed a really good meeting, Matt, when we had that.
I'm not sure my mic is still on, is it? Yeah. I guess what I'm saying is the plan is not specific. I mean, the guidelines aren't specific, like if we hit this number, this is going to happen.
No, because every plan that you would ever put together, you would never be able to surmise each of the situations. For example, you wouldn't be able to surmise what happens if it's 2 kids on a bus versus 15 kids on a bus. What if it's a specialty bus? What if it's an athletic bus? And I use that as an example because the reason that we have a rapid response team set up by the state, as well as the Department of Health, going through this process with us, is they are the medical professionals. So they need to hear what situations are. So when we report to them, we report how the student, if there's symptoms, if there's no symptoms, if there's siblings, if they're in activities, and this would be staff as well. Are they in activities? Have they been isolated? When was the last time they were in school? When was the test? Was there a test? Were they referred for a test? I mean, we have an entire questionnaire list that has to be derived with information full before it goes to the Department of Health. And then those are very specific. And I can say that every situation that we have had has been very unique thus far. And when they receive that information from us, then they have a nurse who is an epidemiologist specialist nurse. They have an epidemiology team review all of those pieces that we have provided, and then they provide the guidance as to what to do. So our plan relies on those individuals who are epidemiologists and those within the Department of Health who work with epidemiologists, such as the rapid response team and the nurses, who would also be part of that whole complex system.
Right.
So,
I understand these plans can be very complicated and very complicated. But I guess my main point is to speak in layman's terms. If it would have been crystal clear to the community that, hey, we get 2 cases, we're shutting down at one school, we're shutting it down.
I believe the last time I read this chart to the public and said this is what we would be following. So we did say that.
I guess much of the public missed that.
By having the board approve that health plan, the board approved us using those epidemiologists and the Department of Health to make those decisions. So if we move away from it, and I think you're bringing up a really good point here, Matt, if we're moving away from that, we will then need to revise the health plan, and we would need to be putting in our own types of specifics. But we are utilizing the health plan that was approved at this point. We're certainly capable of changing that at this point too, if that's what the board decides.
Right. Mr. Schimmel brought that up earlier about having maybe a specific plan. Like, let's say, we go back to normal in a week or 2 from now, and we get 2 more cases in December. Are we going to, in the high school, are we going to shut down for another week, or is it going to be a different plan, even though maybe everything's the same? So I guess the plan that we approve, that based on those guidelines, and they are guidelines, there's some wiggle room there. And
what we approved was to use the Department of Health, and that's what we followed today. And Until that would be changed, that's what we would continue to follow. So that's why the board is bringing it up at this point.
Well, Curtis speaking. How may I
They
help you?
are looking to change that.
Okay, thank you.
You're welcome.
Okay, moving down the list, we have Vanessa.
Hello, this is actually her husband, Bo.
Hi, Bo.
Hello, from 105 Sunset. Just a couple things to go over here, just listening to everybody. First of all, it doesn't really matter if it's sports, band, academics. You know, we're just kind of wrecking all these kids' lives here with everything that we're doing. And it just seems kind of ridiculous with 2 cases. I understand that you have these guidelines that you're following. And like that last guy said, realistically, they're just guidelines. And you said yourself here during your last answer that every situation is unique and you can't account for every scenario. So they constantly have to be modified and adjusted as we move on anyways. So I guess first question
Bo,
is—
can I just interrupt you just for a second? What I meant
no,
by that
let me
was—
ask my first question. So can the board decide today, right now, that these kids can go back to school?
the board has a health plan in place. If the board wishes to change the health plan, they can do so at any time. And the point that I'm making about each of those situations being different is that we are not epidemiologists. We are not part of that. We're educators. I've always said I'm not the smartest person in the room. I never will be, but we know how to put the smartest people in the room. In this matter, the Department of Health has created those persons to reach out to. The board, when we created the health plan, agreed that that's what they wanted to do. However, they can choose to change whatever they wish to within that health plan document. So if they're going to make a change, we need to review the health plan and we would need to make that change within that plan. And then it would need to be run consistently. So if we're going to say, regardless of situations, whether it's 1, 2, 5, 25, 250, we would need to run with that plan, or it would need to change based on circumstance.
Well, isn't it based off of a percentage right now? Isn't that the guideline?
The guideline is 2 to less than 5%. So for us, that's 30, yes.
Okay, so we're shutting down with 2, but we have up to 30. So it sounds like we're already meeting the bare minimum of the guideline. So we're
have moved
you have
into
up to
that
30
particular
kids.
Guideline, yes.
So you have up to 30 kids, but we're shutting down with 2.
That's correct.
Correct?
Yes.
Okay, that is absolutely ridiculous.
In your opinion,
there's
thank
no
you.
way we should be shutting down. There's no way we should be shutting down for 2 kids. Listen to the people's stuff that you're ruining here. The kids that are going to school that aren't going to be going to school, they're going to get terrible grades. You have honor roll kids that aren't making the honor roll, that aren't learning. You have kids in sports that aren't going to compete. You know, all these the seniors that are going to be behind going into the college. I mean, all these things need to be considered. And it seems like we're not doing that. I understand that there's 2 kids. I understand there's a virus. I understand it's serious, but you live in a borough that half the people don't even believe that, you know? So half these kids are going home, taking their masks off and eating dinner with their parents who just got back from a gambling trip in Vegas, you know, or wherever they were at. So there's no control on this at all. I understand you can control only the school part, but the reality is nobody's getting controlled outside of school. So
Matt,
you're going to get these kids.
10% correct on
Yes.
that. Absolutely.
So if that's the case, in another week, we're going to shut down again when they go back because 2 more kids are going to have it. And then in another week, and another week. So if you set this precedent now and you want to stick with that, we might as well throw the whole school year out the window and put everyone in homeschool. Lay off all the teachers, have them collect unemployment like all the rest of us have to do when we can't work. You know, you got parents at home right now that are collecting half their paycheck, struggling to find out if they're going to put food on the table in next week. Now you're telling them they have to figure out what they're going to do with their children. I mean, this is ridiculous. You're at the bottom end of the spectrum. Unbelievable what you guys are doing. I'm kind of pissed that I even have to log in and deal with this right now. You know, the rest of us have enough shit going on. This is crazy. You know, yeah, everyone's got risks. You got a few years ago, you got a kid that got hit by a school bus. Did we shut down all the school bus? Do we tell every parent we can't send kids on the bus anymore? No, we all have risks every day when we get up and we go out. That's it. Just get your shit together. I mean, that's it. Good night.
Okay, moving on to Bruce Jones.
Board, thank you. Can you hear me?
We
Yes,
can
we
hear
can.
you.
All right, thanks. Hey, listen, I appreciate the few minutes here. I know it's been a long evening, and so I'll try to be brief and to the point. One of the things I wanted to capitalize on was something mentioned by Phil Young earlier. You know, I think Phil did a very good job in outlining all the precautions that the board has taken. I appreciate all that you've tried to do in an uncharted territory where you have no blueprint and there's not much precedence to go on. So I know this is difficult, but I am going to speak to what some of the ancillary learning points are around sports and athletics, and specifically football. And I'm only going to speak to my own household because I have a son who plays football right now, who I have learned has learned what the word accountability means this year. And that may not seem like a lot to many folks, but accountability is a big deal. And there's a few things that kind of branch off that word accountability that I would just share with you that I've watched and witnessed and has been developed and learned by my son this year as he has attempted to be part of a team. And so some of those things are, he's learned to be considerate. Through being accountable, he's accountable and he's considerate to his teammates and to those around him. And consideration can take many forms. But I've noticed him to be considerate in the fact that he does grab his mask, that he is on time to school, that he is responsible. He is a more responsible person because he has bought into what the coach has been teaching his team, and that is we're all in this together. We have to watch out for each other. We're responsible not only to our teammates, but our schoolmates as well. I believe that those are things that have been taught by Coach Peipher this year, and that my son, for the first time in that I can remember, has really learned what it is to be accountable. So there's a lot more to these decisions. I guess the point is there's a lot more to these decisions when you look at should we or shouldn't we allow extracurricular activities. And I get it. It's not an easy one. And I know you don't have a playbook to go back and look through and say, how should we do this? But I did want to make mention of that brief thing, the accountability and the things that have come with it, the learning points that have come in my son that I've witnessed. It's remarkable. It's had a positive impact on not only his interactions with his friends and his schoolmates, but his parents and his brothers, his siblings. And he has learned to buy into something and give of himself to see a goal accomplished. And I think the team has done a tremendous job this year, doing all they can to be safe, to watch each other's backs. And it's extremely disappointing to feel like they're going to have that kind of snuffed out here at the end. They've had such a great year. I hope that you'll consider some of these ancillary things as you make a tough decision. And I appreciate the minutes that you give me tonight. Thank you very much.
Thank you.
Okay, next on the list is Christy Livermore.
Hear me?
We
Yes,
can
we
hear
can.
you, Christy.
Okay. I just want to say thank you for allowing me to speak tonight. I don't really have a whole lot to say. I've had quite a few kids go through that school, and this is my youngest senior year, and I know he's not in the best of moods tonight, and I can understand why. I guess one of the things I wanted to state was like the kids can go, like you can go to CVS and get a rapid retest done. Like I don't even mind myself if I were to go to Milton or out of town and have it done, because if that meant my son could play in his football game on Friday or Saturday, I guess it is, why, if we can't go do that and they get okayed with it, that they couldn't play. Or maybe I'm just reaching. I don't know.
I don't think you're reaching at all. I think if we had those parameters that we could do that for teams, because you're not just talking about your son's team, we're talking about several teams. If that were something
Right,
that could be done in a
but
uniform
I know,
way,
but as a parent, I think I have to be the one to reach out and have the test done to begin with. Like, I've already been in contact. I've reached out to my doctor's office and he's told me of different places I could go. So if he can tell me that in like just a few seconds through a text message, why can't the school have information like that for us?
But I think the doctor has to order it, right? At this point in most places locally, that the test actually has to be ordered by your primary care physician.
Nope, I can get right on the website at CVS and sign my son up to have a test done.
Does CVS do the test?
Yes.
Christina, has anybody reached out to UPMC? I got a message from
And I know
someone that
Geisinger,
says
there's
that
Geisinger places that do it too.
somebody messaged me saying that UPMC have the quick test. Has anybody from the district reached out to UPMC?
If they give me a contact, I'd be happy to do so. When we're working together as superintendents, there is no contact for that. So even through the IU, when we've had our meetings, there is no one person who has that. So if they have a contact, I'd be very grateful for that.
See, to me, I guess that would be something that I would have been wanting to ask before I even came into the meeting. I don't know, because you knew what the parents were going to ask. But that's just me. I don't know. I'm going to say goodnight.
But from the time you get the test till the time you get the results, do you have to quarantine? Because I thought that's what my doctor said, that a few weeks ago, I thought I needed a test and he's like, let's go through the decision tree. And the negative is that if I order the test for you, you need to quarantine until we get the results of the test. So, I mean, but again, if we can get rapid.
Sue, you're absolutely correct. That would have to happen.
Okay, moving down the list, we have Pamela Nelson.
Hi, Pamela Nelson, 225 Bennett Street. Just a couple things that have been following up on some conversations from this evening. Regarding the going to like the virtual meetings and whatnots, I mean, I think, you know, I've been to quite a few board meetings over the last few years, and with the exception of probably twice a year or, you know, when the building was under construction, you usually don't get more than 8 attendees anyway. So I wouldn't like to see you spend $20 on upgrading. Well, I mean, 20 you could spend, but you know, any money on upgrading to a interactive meetings or whatnot, when we have a ton of other bills and student needs and things like that. If people, right now, we're in a weird world, which hopefully we don't stay in for a very long time, but the Zoom meetings work for the world we're in now. And again, you know, I don't know what the attendance has been typically at these Zoom meetings, but in the real world, people don't come to the meetings no matter what. So spending money for a interactive is not well spent money at all. My question, and going back to Dottie had said earlier, as far as the rapid tests, people are pushing on these rapid tests, but even then, if you get them too soon, you can get a lot of false negatives. So my concern is people depending on these rapid tests saying, well, my kid came back negative, but then it was a false negative if it's too soon. So that would be my concern on depending on those false rapid tests, excuse me, even if you could get them. And then, you know, and again, I don't have all the information. I don't ever anticipate to have all the information. You do. And you can't share all those details with us. But like you said, every situation is different. I would assume some of it comes down to contact tracing, even if you've only had 2 cases, how many possible contact tracing points are there, is going to affect your ultimate decisions. I don't need to know that if we have 6 cases, the school's going to close down. So, hey kids, there's been 4, start wearing your masks. No, my answer is start wearing your masks. I don't care if there's 0 or 1 or 2. You have to wear them. I don't care if nobody's been hit by a car, you still have to wear your seatbelts. You still have to stop at the stop signs. You don't start following the procedures when you hit that threshold or are starting to hit those thresholds. I don't need to know what those numbers are. I just need to know that they need to follow those procedures. That's all I have to say.
Thank you, Mom. Thank you.
Continuing down the list, we have Tina Marie Klein.
Good evening, Tina Marie Klein, 1009 Toole Street, Montoursville Borough. A couple things I'd like to echo what Ms. Nelson said about the board meetings. I would like to see those get back in person as soon as possible. However, I do appreciate the Zoom option for people to participate. Ultimately, that goes back to the citizen. We do represent us, and it is our responsibility to be following up on that as well. Okay, we cannot just, put you in place and expect you to do it without us maintaining that oversight, and that is responsibility on our part. Secondly, going back to the issues that Ms. Lacrone brought up about not wearing masks, students, wearing them under their chins, or not wearing them at all. That definitely is happening. My children have been reporting that as well. I guess my question goes back to the discipline process. The reality is, if you have people that are refusing to wear their masks correctly, then they should be excluded from school. The rest of us should not be punished because they can't abide by a simple requirement of the school. Let them learn online. Okay, they're all now crying because the school shut down. They can't play in their football games. Well, guess what? That's why we're here, because people weren't doing that. So you know what? Let's start holding these people accountable. Why should everybody else have to be excluded for people that aren't doing it? People that are doing the right thing. Thirdly, rather. And I don't know the differences, we're talking K through 12 with the Department of Education, Department of Health plan. I work at a local college as well. We have had cases of COVID. We have a protocol in place. We have a program in place. I'm pretty proud to say that we're starting week 11 of our semester and we are still in-person instruction. It is absolutely possible if we're doing it correctly and we're holding people accountable. So that's all I have to say. Thank you very much.
Thank you, Tina.
Okay, next up is Joseph. Joseph, are you there? Okay. Oh, are you there, Joseph? Okay. I think you're having some tech issues earlier as well, so I'm going to move on. We have Dylan Bennett.
Can you guys hear me?
Yes, we can.
My name's Dylan Bennett. I'm a senior football player here at Montoursville. I'd just like to start out by thanking all the school board and the administration for letting us play the football season in the first place and doing what they could to get us back in school and everything going back to normal. But I'd just like to say that our coaches have been strict on us, and they've enforced to us that we need to be wearing our masks and stuff like that. And we're one of the only teams around this area that I know that wear visors on the bottom of our face masks while we're playing. And they're strict on us. They keep us wearing our masks, and we should be always taking our temperatures when we're walking into the building and stuff like that. And I would just like to ask why we couldn't get tests for everybody on the football team, and the kids that don't test positive, why they're not allowed to play. Because I know for a fact that Last week, the Muncie School District had kids that were quarantined from the football team, but they were still able to play their football game last weekend.
There's a difference between being quarantined and being the actual COVID case. So that would make one difference. I don't know what Muncie actually had, and nor do I want to. I think we've got enough going on here. That would be one difference. And the world that we live in, we have not had anybody who can give us a name or anything to say, yep, we're all going to do rapid tests, and then actually go ahead, do rapid tests and quarantine everybody. So if you're going to quarantine, you're going to have to quarantine for as long as it takes to get that result, and until you would be playing the game. So there's a lot of factors that would go into that.
Okay, and I would also like to add on to what other people have said about virtual learning and like being in school full time. I can say that, not to brag, but like I'm in the top 15 in my class, and I can say that this start of the marking period has been my worst grades by far, just with the 2 days in school and not being able to be in the classroom full time. And I think that with just 2 kids getting this virus, I don't think it's right for everyone else to suffer. I think that we should still be able to go to school full time, learning, and also continuing with our athletics. That's all I have.
Thank you.
Thank you.
Okay, moving down the list, we have Anna Baylor.
It's actually Beth Baylor, just using Anna's computer. 1207 Weldon Street, Montoursville. Just a couple of quick statements. As for the board meeting, Zoom versus in person, I think you should consider the blast opportunity. As a person watching the Zoom session, I think it would be helpful to me to see all the board members sitting together where I can see and watch you all at the same time and see reactions to things. Whether everyone is there in person or not. I would agree. I don't know that there's a need. I want to give my opinion on the $10,000 for the camera system. I feel the school district should have already spent the money in the Zoom and the camera and the technology to have in the classrooms, so that these kids, while they're going to school 2 days a week, could be Zooming into their classes on the days that they're not in the school building. And maybe we wouldn't have had such a failure rate with this 2 day a week classrooms that we've done. If they could have actually been able to say, oh, it's 9 o'clock, I'm supposed to be in language arts, and dial in and participate in their classes and have conversations with their teachers and the other people that are actually in the classrooms those days, so that you could have your social distance and actually still participate in classroom. I think that would have tremendously helped.
That's been discussed several times at other board meetings. You can go back and watch what those topics were, and you can see what the decisions were. The primary decisions are, number one, policies have to be created, and number two, as Sebastian pointed out, technology was not available. So, but that is, we've spent many times discussing that in prior board meetings, just so you know that you do have you have the right idea. We also share that idea, and you can go back and check those.
Okay, well, that would have been a great opportunity for some CARES money, as well. And I understand that
it would have, had we been able to get the equipment. We had it in CARES, but we were not able to get the equipment by the time CARES monies run out. So we had to take that out and use different monies to put in. So yes, we agree with you. Absolutely.
Okay. And I understand the whole procedures parts too. I think all the jobs that most of us have involve writing new procedures. I'm with Matt Alexander and Bo. Phil Young, you did a great job. Mr. Jones also, with the accountability in sports. I have 2 kids that are huge sports kids. Nothing has taught them more over the years than teamwork in sports. It teaches you how to associate with people that you don't necessarily like, but you have to learn to get along with. And I think there's no lesson in life better than that, to learn how to deal with people that you don't really care to deal with, but you have to learn to work as a team. And that's what these sports are all about. I think taking away these kids' sports at this point on 2 cases is on the ridiculous end of things. My opinion, and I'm going to state it, you know, it's 2 to 4 or 5%, 2 to 4 or 32. I'm based it on 650. I don't know the exact number in the school, but 32 would be 5% of the 650 kids if there are 650. But we're going to close school down on 2. And I really don't get that. My daughter, who would have been playing in a district soccer game as a goalie this Friday night, is now not playing. Keith Bennett spoke earlier. You know, he has a son, Dylan, that just spoke, that's a senior, who is now not playing in his district game. Many of these other kids that my son, who's a senior, has played sports with for years. And, you know, this is hard on these kids. As, you know, their mental health and well-being is, these sports are a huge, huge part of that. And I'm a public servant, have been for 20 years. I've dealt with kids, as Coach Gorini mentioned earlier. I know he deals with it in person. I've dealt with it for many years as well. You never know what decisions like this, how they are going to affect these kids. And you really need to consider, is closing down school and taking away sports for this soccer team and this cross country and these football players and tennis and the band and the color guard and the cheerleaders, all these kids, is taking all of this away going to do more damage than the 2 kids in the high school that are ill? And I think that is certainly something that needs thought about. And I am going to task the board with, I think this is your decision. I don't think this is one person's decision. And I think the Department of Health is a recommendation. It is not a, there are 2 people ill, we need to close down the whole school. And I tasked the board, the people that we elected. I've circulated petitions to get some of these folks on the board, and I've stood at the polls to
Are we frozen?
Anna, are you there? I think you cut out a little bit.
Yes, the computer.
Okay, can you hear us? Okay, I'm going to move on, but if you get your computer working, go ahead and raise your hand.
Hey, Sebastian, hang on before you move along. Christina, I wanted to make, I need a clarification. It wasn't just the 2 student. It also was the contact tracing demonstrated there was nearly 100 other contacts who now are out of school, right? So it was this cascading effect from the 2.
Yes.
That led,
Dan,
that
how
led
many,
DOH.
I'm gonna let that one be up to you, Dan. How many was the total?
Well, first, I'm not going to confirm that they were student cases. We are just calling them positive cases. The first positive case affected 93 students. The second positive case, which I'm in the process of contact tracing, which we were all under the impression that the state would be providing that service. That is not the case. It appears that I am charged with the contact tracing. We are at 43 currently. The issue becomes the band. They have changed the rules today, as a matter of fact, where it went from 6 feet of distancing, the band should be 12 feet. So that was news to me, that they've changed on us. So that 43 may expand to more as I take a look at seating charts and seating arrangements to see what 12 feet is. So between the 2, we may be approaching 150 students with direct contact
At this point, there's no staff with direct contact that I can confirm. So 150 students may be out of school for up to 14 days. That will be the Department of Health's job to make those phone calls to determine. But my guess is it could be up to 14 days for 150 plus students. This also counts, that's including the 7 days we're out, so.
Right.
So so Christina, the two in and of itself maybe isn't the big deal, or it is, but if you're the parents of them, I guess it is, but it's this idea of the other 100 and some that were in contact, and it's the whole picture that DOH looks at, right? So just to single it to two isn't that simple, is it?
That's correct.
That's helpful. Thank you. Yeah.
And just let me define direct contact and how that was used. It is 6 feet, within 6 feet of 15 minutes or more.
We are not using the new parameters that CDC changed to. Pennsylvania is still using 15 minutes of solid contact.
So in cases of classrooms, I had teachers actually have measurements on their seating charts where we had more than 6 feet. We didn't add that student to the list. Where we had less, we added that student. So in a lot of cases, it's not the whole class. In classes where they're up and moving and it's impossible to know exactly who is where when, for instance, ag, in the metal shops, the wood shops, gym class, where they're very mobile and independent of instruction from the teacher, where they're working individually with the teacher. That's a case where the whole class ends up on the list of a direct contact because it's impossible to know exactly who had contact with who and when. And I'll remind you, we have 9 periods of classes. So with one case in a classroom, times 9 classes, if it affects 6 kids, it expands pretty quickly when we do contact tracing and utilize their definition of close contact. So I hope that helps explain. In an ideal situation, you might be at a minimum of 50 kids with 1 positive case. So, and that would be ideal, as we're seeing with the second positive. I can tell you the second positive was not there all day. That's why we're only seeing in the 40s. They were there for just a couple of periods. So you can see, I hope by those numbers, how this can just expand rapidly amongst the staff and students in the building.
But Dan, that expansion you're talking about would be contact with a contact person.
Yep.
So they wouldn't be included in the 150 or so number that you speak of. The 150 or so that you speak of supposedly are because of direct contact, not contact of contact, right?
That is direct contact of a positive case. That is not the, they have a term for it. Oh, I can't think of it right now.
A contact of a contact.
Contact of a contact, yeah. The indirect contacts is what they sometimes refer to them as. So an indirect contact would be somebody coming into contact with someone that was in contact with a positive. So the bus rider example you heard earlier, you know, they're okay on the bus because they're indirect contacts. They didn't come in contact with the positive case. So I hope that helps explain.
So the expansion you talked about is really inconsequential, right?
The expansion is directly because of the positive case. I'm not sure what you mean by inconsequential.
In other words, you're saying the expansion is contact with a contact person.
I'm not talking about those. That
No.
150 number is direct contact. 150 people came in direct contact with a positive case to this point.
Okay.
I'm not talking about the 300 others that came in contact with those. I think that answers it.
Yes, yeah, it does. Dan, I
Okay.
just wanted to, I mean, we have 200 and some people here. I wanted to make sure that they all understood what I was talking about.
Yeah, that's 150 that have come into contact with a confirmed positive case.
So what, the question is whether we keep the school open, but those 150 people are quarantined for 2 weeks? I mean, what are our other choices here?
The direct contacts, regardless of the decision, are probably out for 14 days.
What if they're tested?
Doesn't matter. They've come in
They are
contact
still out.
with a positive. They're still out. That's what we've learned today.
And that's
Even
the
with the
Department
negative
of Health.
test result?
Correct. They'd
Yeah,
have to
'cause
test
the false
negative
negatives.
twice.
That's directly from the Department of Health.
Because of the incubation period and the false negative rate, right?
Correct.
So even with masking and distancing, they're still considered part of the numbers as far as tracing goes, even with precautions.
Distancing, no, the distancing is within 6 feet. You're correct on the masks. If they have a mask on and they're within 6 feet, that's a direct contact. If they're outside that 6 feet of social distancing, that is not a direct contact. So if basically, to simplify it, if they invade your space, that's a direct contact for 15 minutes.
Thank you.
Yeah.
Okay, I'm going to continue down the list, and we have John.
Good evening, John Warner, 80 Scott Lane. Just have a couple questions that I need some clarification on. So my situation is that my son is a high school student, football player, who is one of the students involved in the contact tracing. So he is, I believe, what you considered excluded for 14 days, I'm learning. My question is this: I have 2 other students in the same household in 2 other Montoursville schools. They are still allowed to go to school. So if the only thing keeping our sports teams, and granted my son is out for 14 days, so he does not affect him. But if the only thing keeping these teams from playing is our willingness to certify, it would seem that our district is willing to send siblings to different schools, but not certify the rest of a team who has already been ruled out of the contact tracing. So I'm looking for some clarification why we're going to send siblings in the same household to different schools within our own district, but not certify a team to play in playoffs, whether it's soccer, football. My daughter runs cross country, so just seems odd to me that it kind of seems like we're picking and choosing. I'm not sure if any of the policies we have covered this scenario. So if the policy doesn't cover the scenario, it would seem that the board needs to make a decision on what to do tonight. Thank you.
Thank you, John.
Okay, moving along. I have someone on an iPhone.
Hi, my name's Jenny Miller. I am at 223 North Lowestock Avenue. I have a few concerns, as well as other people do. So I don't know if it was 2 months ago, a month ago, there was at the varsity level for the little kids, football and cheerleading. There were concerns because there were positive cases there. Now, mind you, that was with elementary school. I think it was just elementary school. But there was and it was around about the same time that there was talk for the other school board meeting. And there was no concern with anything at that time. Now, mind you, that's at the little school level. But the cheerleaders had to quarantine, but the football players continue to play. So there's questions with that. And I know that this is high school, so I know that that's no concern with that. My other concern was not concern, but I wanted to bring up, I work for UPMC and I schedule many people in a day's time for COVID testing. Some people because they have the sniffles, some people because they're concerned because they were at the grocery store, some people because they were concerned because they were just in Jamaica. UPMC will not test for asymptomatic people. So I take it upon myself to allow people to know, and I have taught myself to allow people to know that CVS and Walmart, they do offer the 24-hour testing. You will get a response back within 24 to 48 hours. So UPMC does not offer asymptomatic testing. Along with that, my child is a junior and he plays for football, and he is, as well as other people, are super upset. And my concern is everybody was super excited to get back to 5 days a week, everybody back to school 5 days a week. Now we're back to school 5 days a week. And I gave it until December that we were going to be back to the hybrid. We were going to be back to everybody back to the 2 days a week, or Monday, Tuesday, Wednesday, Thursday, whatever it is. And now we're back to school 5 days a week. And now we have 2 positive cases. But yet 2 months ago or a month ago, we had in the middle school these 2 or 3 or 5 positive cases. I'm not exactly sure, but none of that was brought up and nobody was concerned about that. And the schools weren't shut back down. So I'm concerned because our kids are losing out on their high school years. They're losing out. And I know that this is not anybody else. I get everybody wants to do what they want. Everybody wants to get back to, normal, whatever normal might be. But it wasn't ever brought up that kids had to quarantine when the little kids were tested positive. And it wasn't brought up when the coaches tested positive. And now we have 2 cases. And this was 5 cases when the little kids tested positive. So I'm concerned because where is the cutoff? Where's the cutoff?
But is that the issue though, that the close contacts are different for every case? So the main criteria is how many other people did each positive case?
They were at they were at practice. They were at a cheerleading practice and heading to a football game that they found out that they were positive. And they went and they had that football game And then it was talked about these cheerleaders had to quarantine, and then the football players continued with their football games, but the cheerleaders had to quarantine. And there were siblings in the same class or in the same household, cheerleader and a football team or football player in the same household. So it's a fine cutoff, because I heard somebody got cut off earlier because they were saying that they had to go and pick their kids up at the bus stop. Nope. Nobody has any contact with any of these kids that are right now that we're speaking about. But yet these parents had to come and pick these kids up. So I don't know. It's a fine cutoff, but we need to figure something out, because football, soccer, everybody's been playing contact sports. You're taking kids in from outside of the households. I mean, I could go on and on and on, as we all could. So what is the right and wrong answer? I don't know. But can we figure out, as Montoursville Area High School, to get 24-hour testing? Probably not. I mean, UPMC is a multi-million-dollar company, hospital. CVS is doing it. Walmart's doing it. You want your kid to be tested? Go to CVS, go to Walmart, go to MedExpress. Can we get our kids tested before these games? Absolutely. Can we get the tests back? Absolutely. So why aren't we doing this? Am I frozen, or are we just speechless?
No, we're not speechless, but I think that you're either asking us or you're asking parents. I wasn't sure what you were asking.
I'm just asking for my child, my children, and the team to be able to play, because they already lost from March until June of their last school year. And now my child even said to me, we went back to school and now all these kids we have 2 positive cases. 2, but how many positive cases have we had prior to this? But we still went back. We still went back to school, and there were still positive cases.
Okay, I'm going to fact check you here. We did not have positive cases that were student-related positive cases. We had parents.
In the Montoursville area school district, have we not had positive school or positive kids tested? We have not. You're kidding me? Are you serious?
We have had reports of exactly what you're speaking at the elementary level. There were quarantines issued, and those were not then during school hours of any kind, where there would have been any kind of contact.
Was that school hours, or was that the hybrid?
That was hybrid. That kept us going because it was a very limited amount, rather than
We were still in school.
Together.
They were still going to school, so they had to quarantine. They could not go back to school for 14 days.
Are we talking about the youth sports program,
Yeah,
where not
are.
everybody was honest with their testing and such?
Correct.
Regardless, they were still positive tests, and those kids still played in their football games.
So you're telling me that we did not receive information about positive tests?
I am speaking upon kids that live 10 feet away from me that had to quarantine from practice. They had to quarantine from games.
Because they came in with a positive contact.
They did not. There was somebody on that team that had a positive test. So the entire team had to quarantine. One person tested positive, whether it was the team or whether or not it was a coach. The entire cheerleading people had to quarantine, but the football players continued to play.
I have to step in here and just remind you, and I understand your concern and your frustration, but the school district does not have a say over those athletics. The district has no control over those athletics at that level. They are not.
The school
schools.
district told the school district told that particular sport that they had to quarantine for 14 days. They were not allowed to go to school and they were not allowed to participate in any of the activities.
Absolutely,
But the football
they weren't allowed to
players
go.
were allowed, but the football players, the same team that those that the cheerleaders were at, the same team was still allowed to play.
And that's what I'm saying. The
they weren't
school
within 6
district
feet,
cannot
right?
stop them from playing. It's not a school sanctioned team. If it was a school sanctioned team, the school district could stop it. I understand totally what you're saying. And those cheerleaders, the school, once the district found out that there was a positive case, the school district had them quarantined because they was in direct contact for 14 days.
Yeah, no, because the district obviously doesn't have the right information on this. We're hearing some information that is new. We can't resolve that here and now. So we have to move on. Jenny, is there any other comment of any kind you'd like to make regarding the issues on the agenda or anything
I
like
just
that?
know that this is new to everybody. This is new to the entire world. And I feel bad for the people that are suffering because they cannot continue with their schooling. They cannot continue with their athletics. They cannot continue with everything that they want to do, just having their friends be friends. And I just hope that you guys will consider, they've already been in contact. Half of those kids, they go to the football games. They're not from the same household. They're not 6 feet social distancing unless their coaches are yelling at them. And these kids have done everything and anything to be able to get to where they are today. And I just hope that you guys take it into consideration. It's 3 days away, 3 days. And from what I'm understanding is the people that tested positive aren't even on the football team. They're not even on the football team. However, the kids, the 20 kids that have had direct contact, I hope you guys can take into consideration and make this happen for the soccer team and what other teams need to play for Friday night and also for Saturday.
Thank you.
well,
Thank you, Jenny.
we
Thank you, Jenny. We hear what you're saying, and this is important to all of us. So thank you for your comments. So let's keep moving on to the next commenters.
Well, can I say, so if we're learning that CVS and maybe Walmart can do the rapid testing, then I guess the only thing I can think of, can we turn it back to the parents of the other kids on the team and say that any parent of any player who can provide a negative result rapid test will consider trying to make some of these, allowing these players to play in the next 3 days, or is that not feasible?
I think let's work our way through public comment, Sue, and we'll pick that up as a board discussion later on, okay?
Okay, Mr. Conkle has been waiting patiently. He has Scott Metzger on the line, so I'm going to allow him to speak at this time.
All right, Scott, you're on.
Good evening, everybody. Thank you for taking my call. I've been sitting here for the last 2 hours and 45 minutes listening to our people in our area, and you hear the consensus, what the people want, and I'm gonna try to condense everything as quickly as possible. This is the first time we've quarantined the healthy to protect the sick. The CDC never ordered lockdowns. The governor did. And the Department of Health, and I want to speak to you as a parent who has a sophomore over at the high school who came home today crying, who's on that soccer team. And I'm going to speak to you as a county leader and as a taxpayer. And this is not a decision for the superintendent to be making solely by herself.
The
You are elect-
superintendent did not make the decision, Scott. The superintendent followed the health plan. The health plan was approved by the board. So let's get that straight right now.
Last time, and I don't want to be cut off tonight. I want to get what I have to say, and then I'll ask you if you have any questions, please. Okay? I'm an elected
I have
official
questions. I have answers. I don't have questions.
for years.
May I ask questions too when he's finished?
Yep.
What we do with the county is we have 550 employees. We have 8 COVID cases since May. We didn't quarantine people. Those people stayed home. They stayed home. What we did is we put together a task force, and they meet every week, and they bring recommendations to us what we should do moving forward. We have thousands of people come into our buildings, and we protected those people. And we did that as elected officials. I didn't bunker down in a basement or my living room. I've been going to work every day since March to try to solve the problem for the county, and you should do the same for the district. This plan that you've adopted is not realistic. It's set up for failure. To have 2 people, and you're taking the bottom of the barometer, and you're shutting down a school when it can go up to 30. For crying out loud, Penn College has 50 cases, and they're still open. The Department of Health, I deal with them every day. The governor, they have mismanaged this horribly. They continue to expand the field. It was, we're going to shut down for 2 weeks because we've got to get this under control, flatten the curve. Then they expanded the field, and they kept expanding it because we started to open back up, and they saw that we could open back up safely. And I'll give you some stats. No, we can share the number of cases. That's not confidential information. You can tell how many cases are on a bus. You can't share addresses, and you can't share names. We have 156 in-county addresses at this time. There's 13 people in the hospital. There's nobody on a ventilator. Okay, we've had 1 kid since March in the hospital. 1 kid in the entire county. This virus is not going away. And this system, if you're going to say it's two people, we're going to shut down the entire school. They've expanded the field now. Now it's contact tracing. We have to keep all these people you come in contact with locked down. Well, if that's the case, you better not go to Walmart. You better not go to Lowe's because, God forbid, you might have talked to somebody who has COVID. It's insane what's going on. There's no blueprint. We didn't have a blueprint to follow. We've done the best we can do. But you have a responsibility to get these schools open and safely, just as we did with the county. We did 15 different directives. We did 3 press conferences. And we put together a committee to do it safely. And we've done so. And you can do the same exact thing with the schools. Now, we've given the county, we've given the school districts $3.1 million worth of CARES money. I signed those documents. I would ask you to please post on your website where those monies went to, because everybody in the county should see where you spent those monies that Dr. Bason you shared with tonight. They've already been spent. And also, I do have a question before I get off the phone here, is how many cases we had in the hybrid model, because I know there was cases. I know that for a fact. And what was done with those cases? And now all of a sudden we go 5 days, and within 1 week, we have 2 cases. We're shut down a school. Okay? Leaders lead. Sheep follow. There's been a lot of sheep following that Department of Health. And I can show you day in and day out. I spoke to that Department of Health. We had to get the county over. We sent them a letter. They had no idea what the geographics of Lycoming County was. They didn't know the population. They didn't know how much square footage per building. They didn't understand what the population was in a school or a building, a county building. They used facts straight across the board, just like an insurance agent looks at a chart and says, you fit in this category, and this is what you're going to do. We can't put people in little categories and say, this is what we're going to do. Okay? This plan you're developed is set up for failure because guess what? When you bring these kids back in 2 weeks or a week, there's going to be 2 cases again. And these kids aren't yo-yos. Vic Gorini hit it right on the head tonight. He nailed it. You're messing with kids' mental health. And you have a responsibility as a school board leader. And if you don't want to take that as serious as I should, as an elected official, you do not need to be in that seat. Okay, I'm very blunt when I say this stuff to people. I'll praise each one of you. Dan Termini has done an excellent job. And Dan, you should not be doing contact tracing. You sit there and say you guys aren't health officials? Well, that's a health official's responsibility. And Mr. Termini, you should be required to do that. That's not your job.
And Scott, my question to you back in the summer when I attended a county commissioners meeting was, will we have tests to be able to keep us running? Because if I had tests, and you've heard that theme tonight, if I had tests, we would be playing football Saturday, we would be playing soccer Friday. And I asked then, nobody had an answer for me then, nobody has an answer for me now. Why don't we have access to testing? You can throw all the money you want at us. It's not enough. I want testing. I don't want cash. Right. Because testing will keep us open. Testing will be able to keep us educating. And I know I've done this a long time. I know what's going to work in this. Yeah, there's no playbook for a pandemic, but I know testing will get us what we want. And there wasn't an answer from you then. There isn't one now. And I don't expect one 3 months, 5 months, 6 months from now. I keep hearing the election's going to take care of this. It's not going to. Testing will take care of this. So please, I ask again, as my elected official, my elected county commissioner, can you please get the schools rapid testing so I can test our athletes, so I can test our kids, so we can educate, so we can take care of their mental health and all the other things you hear about from our parents, from our kids, from our staff, and yes, from your administrators. Please get us testing. That would do the trick.
I tried. Our county leaders have tried. The state is a disaster. The Department of Health is a disaster. They couldn't even give us our numbers when we talked to them that day. When I sat there and we got opened up on Friday, they couldn't even, and I said,
then I would ask, try harder. Instead of asking for my boss's resignation or my boss's dismissal, my superintendent's dismissal, I would ask that you please work harder to get us testing. It does no good to attack her. It does no good for the public to attack me. It just doesn't work right now. This isn't helpful. I am asking for testing. That would help our parents. That would help our kids. For you to ask for her dismissal over this is wrong as an elected official, Scott. It's just flat wrong. And you owe her an apology tonight in this public meeting.
Please.
And I ask again, give us testing.
Thank you, Dan.
What I'm saying is, this is a decision for the board. Elected officials. It's not a decision for a superintendent of a school.
The board made the decision, Scott. They approved a health plan. They've approved a health plan twice.
Christina, they went by a recommendation and guidelines of two people out of a high school. Your bottom measure of that, it goes up to 32. You said 2, we're shutting it down. That is not a plan. That's a
You follow what is in writing, Scott. That's what leaders do. They follow what's in writing. They don't make it off the cuff and they don't go by emotions. The board made the decision. We followed the decision. I contacted the mental health people, or I will be needing to. I contacted the Department of Health people. Those are the people who actually know what to do. They're epidemiologists. They are nurses. If they don't know what the hell they're doing, then someone needs to help them learn that. And if you have direct contact like you say you do every day, then please help us with that.
Okay, and you know what? Those people disagree with everybody. Okay, first it was mask, no mask.
I don't care if they disagree with everyone, Scott. I'm asking for your help. You have their ear every day.
Will you let me finish, please? Stop interrupting me.
Oh, thank you, Kamala.
Now, there you go, interrupting me again. 92% of Americans are wearing masks. Mask is not making this go away. It is a tool. It is a tool. People who wear the mask get COVID. It's not going away. You can do contact tracing. It's not going away. Nick Saban just got this. He was asymptomatic. He wore a mask all the time. Okay, it's a tool. It's not a cure-all. What I'm saying is we put the safety measures in place like we did with the county, and you learn to live with this. You have 2 kids with this. You don't expand it and say, well, they had contact with you know what? Guess what? These kids are going to be home all week long, and I guarantee you they're going to socialize and hang out with each other. And they're going to come back next week, and the kid's going to test positive. And then what are you going to do? Well, he had contact with 300 kids. So now we can't have school because they had contact with 300 kids. You'll never get anywhere. You're not advancing the football. And I can tell you right now, talking to the state is like talking to deaf ears right now. They won't even respond to our state representatives. The Department of Health, Garth Everett, when it came to that nursing home crisis, he reached out to them over and over and over and over and could not get a response. This is the Department of Health that you praise. They do not. They have their own measures. They disagree with each other on a constant basis. You see it on TV. They're scientists. They're not God. They're not experts. And they're going to have the people who agree with them put these guidelines in place. This is a local issue that you need to met. We need some common sense here. We have common sense in the county government right now. We have a responsibility as taxpayers to have those buildings open. You have a responsibility to these kids and these parents. Our kids' mental health is being affected like you would not believe. And you know that because I know you truly care. You do truly care. But you're so afraid. You're so afraid of what this governor and what the Department of Health says that it's disgusting. Well, guess what? They don't run our lives. They don't run our lives. We do. And we can do this safely and we can do this cautiously. And you need to make the decisions as a whole and do the right thing. Use common sense. You don't shut down a building because of 2 kids and because maybe they had contact with 150 kids. We'll try to get the testing, but guess what? It's going to be few and far between. I highly doubt if we're going to get it, but we'll keep trying to get it. Now, I'll take any questions if you have any.
No, but I'll take an apology.
Like Dan said, we need the test to know who's negative. If we don't know who's negative, we have to operate under the assumption of that everyone who's in close contact is at risk. We can't deny that assumption and assume.
And you'll be positive if you test again. Okay? You can't test constantly day in, day out, day in and day out. This is a virus. It's out there. Dan hit it right on the head earlier. There's a 99.997% chance the kids are going to survive. Even the people over 70 now, it's a 99% chance you're going to survive. You protect the elderly. You protect people with health conditions. We can't keep living like this. We can test till we're blue in the face. We can wear masks till we're blue in the face. This is going to be with us for a long time until we get a vaccination, which may never come. But we can't shut down a school system because of 2 kids and the fear that they may have given it to another 300 kids. That's not common sense. That's not good leadership because the CDC says different. The CDC told you a while ago, lock things down, shut down things. Well, guess what? Now they come back and they say, that wasn't such a good idea. These people constantly change their minds back and forth. The scientists argue with each other on a regular basis, back and forth. There's no blueprint on this. We have to do what we feel is the best and safest option.
We have very public examples of where testing keeps things going. We have very public examples of where testing keeps things running.
All right, folks, we've had a very robust discussion on this, and I think we've gone in circles about 3 times. And Scott, we hear what you're saying, and a lot of things you say, you're preaching to the choir. So we're on the same page in a lot of that stuff. I work for the state, and I know what it's like. So look, we get it, and I'm trying to make up for some of the glitches last time you talked, but I think you've had about 8 minutes here, my friend, and I understand what you're saying.
Talking to the states like talking to the hole in the wall right now.
Yeah, gotcha. I understand. So, nope, we've taken under advisement what you said. So we got a lot of other people that still want to talk. So Scott, we're at 10 o'clock and we've got other hands up. So let's move on to them. But thank you, Scott.
Okay, next on our list here is Kelly Biddlesbacher.
Hello, my name is Kelly Biddlesbacher, 1927 Lake Road. I just have some questions. Mr. Taormina answered some of them when he started talking about contact tracing. I'm just looking for some clarification on DOH's current recommendations for contact tracing and what the direct contacts are considered.
So again, the contact tracing is within 6 feet. So again, invading your space, to put it in simpler terms, within 6 feet for 15 minutes or more. And that's masked or not masked. So if you would have a kid working at a teacher's desk, as an example, for more than 15 minutes, sitting side by side, and one of those persons tests positive, that would be a direct contact. The rest of the class that might be 6 feet away would not be a direct contact, would not get a phone call, and that's the end of it. In a setting where we're in shops, where kids are up and moving, phys ed class, where kids are up and moving, where it's not as easy to determine where kids were at a particular time or for how long, that ends up being a situation where we're not sure, and we are currently putting down everybody in that class as a direct contact.
Okay, and so that's where I was looking for the clarification. So basically, if your child is in a shop class, because it's more difficult to actually determine that, is there any conversation being happening with the actual children?
Well, the issue with, I'll use the metal shop as an example. We have a welding station, we have a hot metal shop, we have a bending station, and then several milling stations, plus some workbenches. They will go between those different stations maybe 6 or 7 times during a 30-minute period. So they are essentially in close contact with each other for that entire 30 minutes. So other than shutting down those labs or specifically saying this group is in welding today, this group is in hot metal, and that's just not possible to teach that course, I don't know how we control to be able to limit the direct contacts in a positive case in the shops where they're up and moving.
Okay.
I mean, that's part of what I'm proud of in those programs, and why we built that building was the hands-on experience. And to take that away, in addition to everything else that's falling right now, the course wouldn't be the same.
I agree with that. Definitely proud of Montoursville offering those hands-on experiences. So if you received an exclusion email, then you can expect to receive a quarantine phone call from a tracer. Is that the process?
The Department of Health, not you specifically, but those that have been in direct contact, those names have been provided to the Department of Health. 2 phone numbers, an address has been provided, and they will be in contact. What I'm hearing and my understanding is that in most cases, that's a 14-day exclusion from school. I don't know if the Department of Health at that time switches it to a quarantine or if they continue to call it an exclusion. Again, I'm not, because this is our first time through a positive case, I'm not completely certain of their process, and I don't know that I'll ever hear from them what their process is, but it'll be anecdotal evidence that I collect from parents that have been through this process. That's the only way I think I'm going to know how it works and what you're told.
And
because I am going to be following up with some of the folks that have been put out of school here to see what that process was.
are you aware of, you said a 14-day exclusion or quarantine? You're not sure what it will be termed as. That's fine.
Right.
That 14 days, is that from last point of contact with the positive student? Or how do we know when the 14 days starts?
I think it's the last point of contact, but that's going to be a conversation with the Department of Health that you'll have.
Unfortunately, my understanding is when the Department of Health calls, it's just going to be one of these tracers that the state has, hired all these random people off the street and given them access to call people's phones. So
Yeah, I believe I'm probably doing more than they are.
Yeah, you're not going to get, we as parents are not really going to get to speak to somebody, as Mrs. Bason has stated, that's knowledgeable and a nurse and understands what's going on that works for the Department of Health. We're going to get to talk to a tracer. So, you know, my concern is that if these kids are being considered direct contacts just because they're in a class that's more active, even though they really may not have had 15 minutes of continuous contact with the positive, that affects other family members. Those of us whose jobs will not allow us to work based on that when it might not actually be factual.
Yeah, I understand. It's the definition I was given to work with.
Okay, thank you.
Okay, next on our list is Dylan Young. Dylan, are you there? Can you hear us? Looks like you're still muted. You'll have to unmute yourself. Okay, still hearing nothing. I'm going to put your hand down, and if you get things working, go ahead and put it back up. Moving on to Kimberly Wren.
Hello, everybody. Sorry, I wasn't ready for that. 1105 Nicely Avenue, Montoursville. I'm sorry, I'm still shocked by Mr. Metzger. The only thing I wanted to comment was my understanding from my place of employment is that you cannot test out of a quarantine. If I am in contact with someone on Monday that tests positive, I need time to actually brew the virus if I've contracted it, and I might not get a positive test until Friday. So just running out and getting a test is not going to clear anyone. That's not the solution to this problem. The solution is we should have stayed on hybrid, because we were all protected then because we were still at our 6 feet with our masks. And that's why initially, whatever cases anyone was talking about were protected. I'm not blaming you guys. I understand the need that everyone had and everybody wanted to get back, and our cases were doing good and we were looking really good. But the reality is we knew going back full time with all students, this was the likelihood when cases started. So now we shut down for 5 days. Everybody takes a breath. We separate everyone. We see who tests positive, who tests negative, and then we can come back together. This is just what we have to do. This is how we have to deal with this. That's all. Thanks.
Thanks, Kim.
Okay, next we have Kristen Evans.
Hi, Kristen Evans, 117 Colonial Drive. I actually have a question that just came into my mind listening to the last person that was arguing that we should have stayed hybrid. I'm willing to say my son has been caught up in this close contact situation. He is now, I guess, because details have been sketchy, and I did have to check out of the meeting earlier, so maybe I missed this information. I guess now can't return to school for 14 days. Even in the hybrid situation, Mr. Taormina, were the kids 6 feet apart in the shop, like in the wood shop, in the metal shop, or if a child had come up positive, or a teacher or someone else in the building had come up positive for COVID, even in hybrid, would this have still been the situation? Because in those circumstances, they're moving around, whether we were hybrid and they were only there 2 days a week, or they're there 5 days a week. Am I correct in that assumption?
Yeah, hybrid was much more manageable in those open type classrooms where kids are up and moving.
But they were still touching the same machines and
Yeah, and
those types of things.
It's not even surface contact. It's proximity to another person.
Okay. So
It's
even
not so much a positive person could touch a, I don't know, a saw in the wood shop, and someone else could
Right.
follow up right behind them. But as long as they stayed 6 feet apart, that would not be a direct contact. And I think even if you notice some of the stores that you visit, and I know we're compared to Walmart and different grocery stores, but you know, you don't pack your lunch and eat 30 minutes in those stores. You don't spend 8 hours in those stores, and it's not quite the same. So the contact with surfaces, if you see in the stores, they've quit wiping between customers.
Right. I
They've
noticed
quit
that.
those heavy duty wiping the keypads. They've backed off on all that because it's not so much surface, it's aerosol. It's spread through the air. That's why the masks are important. That's why the 6 feet of distancing is important. And it's much more manageable in a hybrid setting because you have, of course, fewer kids. When you get into a fully operational school building, we have 561 kids show up. Your hallways are packed. We have kids, they're spread out in the cafeteria. We've managed that because of the new building and the big space we have. But when you get into the shops, those are our electives. They're very popular. They're 15 to 20 kids in those shops, and it's hard to maintain the 6 feet in those spaces. When you get into the ag building, you have a greenhouse, you have an animal lab where they're raising chickens and different things. You have a butcher room. It's hard to maintain when you've got 15 to 20 kids running around in all those different spaces.
And I understand that. My question initially when I raised my hand was, is there going to be more directive to come in terms of how they're to continue their education? I mean, now everybody's out. So that's good for at least the next week. But had that not happened, and then moving forward, if my son has to stay out an additional 7 days, will there be some sort of communication district-wide about how they're to continue getting that information? Will it come individually from teachers? Like, as a parent, we'll do what we have to do, but my bigger concern is making sure he's still getting the work he needs and those kind of things. And again, with the whole school shutting down, not so much an issue for the next 7 days, but with him not being there, but other kids being in those classes, how will they keep those kids up to speed?
Yep. So quickly, the beauty, and the admin team knows how much I love hybrid. The beauty of that was that it allowed us to get started and get everybody on the Chromebooks, get the staff, the teachers used to Google Classroom. So we will be shifting back to Google Classroom over the course of during this particular closure, depending on the outcome of this meeting, I guess. But teachers will start putting together more robust lessons. Some of the things we saw during hybrid where students could pause their videos, rewind, rewatch. They'll put those together Wednesday for classes, for online classes, Thursday, Friday, Monday, and Tuesday. The hiccup in all of this is, and we'll be sending out a parent link with this information as well, is in hybrid, they could come into the building and connect once in a while. Under this, they're going to have to, if they don't have good quality internet or access to the internet, they're going to have to come to a school parking lot and grab those materials to be able to work. So that'll go out in a parent link. In situations where we have students that are excluded from school because of direct contact, all of that will be posted to the Google Classroom by the teachers. I know a lot of the high school teachers have reached out to students. They know which students are excluded. There's been open communication with everyone on staff of who's been excluded, so they are aware and will reach out, as well as students checking their Google Classroom. So again, that too will also go out in a parent link.
And then as far as them returning, that directive will come from the Department of Health?
Yes, I believe so. And again, I have my concerns moving forward with them. So I will make sure I pay very close attention to dates they're providing parents. And if they're not, we will come up with something. I would imagine it's going to be closer to that 14 days.
Okay. I mean, I'm happy to share when we finally hear from them, if we hear from them.
Please do contact me. I would appreciate it.
Sure. Thank you.
All right, thank you.
Okay, next on our list is Maya Wilson. Maya, are you there? I can see that you're muted.
Okay, can you hear me?
Yes, I can.
Hi, yeah, this is Brett Wilson, actually. So I know everybody's concern here that's on the call is for our students, our children. Their lives have been turned upside down since last March. They've all, been doing the best they can. Mental health, it's been brought up many times tonight. I think that's the biggest concern with the schooling. A lot of issues with the hybrid model, kids being able to get their assignments completed, handed in, with internet problems, with living out in the country. We obviously have some, internet issues where the kids were turning in homework assignments and they weren't getting turned in properly, or there was internet issues. So obviously we want to get the kids back to school. But I think it's very unfair. I mean, with the two cases we have, there's got to be, there's a disconnect somewhere. I don't understand pulling the kids out again. Now they're back in, the same issues they were back in March, April, pulling the kids out of the sports, athletics. I just have a big concern for their mental capacity on how they can handle this. That's all I got.
Okay, next on the list, I see CJ.
Hello?
We can hear you.
Can you hear me? Hello, I'm Claudio Signer, 604 North Montour Street. I am a senior on the football team. And one of my main questions was other school districts around us, like Muncie, they all had 2 cases just like us, but they're still playing. So I don't understand why our school is getting shut down, and everyone's saying that we're not going to school, so we're not getting our education. But we all have the online, and back when we were only going 2 days, we had to do the online. So I don't see why it would affect anyone's grades. Our football team really did everything that we were told this year to wear our masks, stay 6 feet apart. All of our sports have. I know our principals really did a good job to try to prevent anything from happening. And last year we got sports taken away from us, and we're just really disappointed that our season had 10 like this. And we're really hoping that something can change. Even if anything, like there has to be something that we can do, like push back the game or something. Get everyone tested. Get everyone tested. Just try to do something to keep us in. I stepped up as a team player this year, moved to a different spot just to help our team. We're all just a family out there on the sports team and just trying to keep the season going. It ended too short. So that's all I had to say. Thank you.
Thank you.
Okay, Mr. Schimmel, I still do see some hands up, but I know that all of them have already had a chance to speak. Do we want to continue, or do we want to allow them to speak at the next opportunity? What would you like to do?
I see 5, so I see a I see a Bob that hasn't spoken yet. So let's go with Bob.
Okay.
And what when you get to open that up for the others who are waiting, if you have a question that you could email the administrator or the superintendent to get an answer, that would be more preferable, as the hour is getting late and we didn't even conduct our business yet. But if you feel compelled to speak, we will certainly let you.
Okay, so this time I'm going to allow Bob to speak.
Can you hear me now?
Yes, we can.
Hello? Okay, this is Bob Lorson up in Elder Township. For the last almost 3.5 hours, I've heard a lot of talk about the state health organization and stuff, and that's what guided our policy and stuff. I think we can all pretty much have a consensus that they haven't done a lot right since this pandemic started. And we put all of our cards in one deck using them, and I think that was a mistake by everybody. Believing in them, and it's not a good idea. I think in a case like this, I've heard a lot of talk about just 2 cases where we could have up to 30, based on their guidelines. Again, their guidelines only. And I think if we take the fact that they are guidelines, a little common sense could prevail. And because honest to God, the hybrid system for education is not working. I have a grandson that was honor roll prior years. Right now, he's struggling to get by with passing grades coming out of the hybrid system. It doesn't work. So let's have a little common sense when it comes to making these decisions. That's all I got to say, except for the fact I think your meeting should be in person, period. No question about it. Because I like to look at people's face and tell if they're sleeping or not sleeping, whether they think I'm full of crap or not full of crap. You can see that in people's face. So I appreciate it. Do the right thing tonight, folks. I'm done.
Okay, I still do see a few hands up. I can move on to iPhone.
Hi, that's Jenny Miller. So I've heard a lot of different things, and everybody's saying about how going back to hybrid or going back to full days and everything. My number one concern, as my child is standing right behind me, is his grades. I mean, it's going to be different with everybody. His grades have escalated. His grades have been awesome because he's had to do the work that he's had to do that's been asked of him. So it's going to be different for multiple different kids. My number one concern for being on here is and I know that this is a school board meeting. I get that. But my number one concern is that they're not going to be able to play 4 days away from their district playoffs. And I know that this is school board. I get this is a school board. I understand that. But it's a contact sport. They've been playing this contact sport since, I don't know, give me a date. that you've been playing contact sport?
August.
August. They've been playing contact sports, and they have been doing everything and anything that they have been able to do and needed to do. And now you're taking this away from them. And I've heard that this is the school board's decision for this to not happen. I've heard this multiple times, for this game to not happen, because it's the school board's decision, not because of the Department of Health, not because of the Department of Education, but it's the school board's decision. So I need to know, is this the school board's decision, or is this the Department of Health, that these kids are not playing on Saturday for their team? Because it was posted that we already forfeited. We've already forfeited the game. And this is not even over yet. We're still on 10/27, and we're still on this meeting. So how is it already posted that we are forfeiting our game on Saturday? Can you guys hear me, or is it blocked?
Jenny, as far as it being a direct vote of the school board to say we shall not play, no, that is not how it plays out. The school board passes policies, and those policies are what the administration uses to execute the operation of the school district. One of those policies has to do with the health and safety plan and the athletic health and safety plan. And the consequence of that policy was that the administration concluded that by default, we can't play because of that policy. Will we change that policy tonight?
But before it said that it was at the Department of Education and the Department of Health, that is why we are shut down at the school district, at the school district.
Separate, Jenny, separate the school shutdown from the athletics. There's overlap, but they are separate. The football issue, the sports issue, yes, it's related to all those kids that were the contact tracing showed they were exposed, but it has more to do with how many kids off the team because they've been exposed, and it has to do with the uncertainty of, can we certify that indeed our athletic teams are COVID free? And that's a big question mark.
So why was it
posted? Of a policy. That's not.
Why was it posted that we already forfeited?
I have no idea where that's posted, so I can't answer that.
So can we push this out? Can we push this out and we play it in the next 2 weeks? Everybody quarantines.
We're gonna talk about that later, a little bit later.
Go ahead.
It's Isaiah talking now. Isaiah Fenner. How is it that Loyalsock had confirmed cases on the football team and they're still able to play? And Muncie also had 2 confirmed cases like we did, and they're still competing in the playoff games. What's
without seeing their health and safety plan for athletics, without seeing what they rely on, their criteria for deciding when they do what, we can't answer that at Montoursville. We can only answer how we landed at Montoursville. We can't speak to the other schools, and it does sound very strange. I agree. I don't get it either, but we can decide our decisions.
I thought we were all going by the same thing. Why is it different for us and not for them?
I can't speak for the other schools. I wish I could. I wish I knew their policies. Maybe I could give an answer, but we just have our policies and guidance, and we execute by, and that's That's our playbook. That's our
the same
playbook.
as, aren't they the same for everybody? The Department
No,
of Health?
no, they won't
No.
necessarily be. No, how they execute the fine details could be different.
Why is it different?
Just the same way on a football team, on a football player, how you run a certain play will be different than how Loyal Sock runs it. Different blocking schemes, things like that. So it's just execution details.
Each district makes their own individual policy. So it's a written policy that's unique or separate from school district to school district about
So
how
it's you guys saying that we can't play because of two kids that were not even on the football team.
I do believe that Loyal Sock canceled 2 football games because of
No, they
probable
changed.
cases.
They changed. They changed their football team or their football games. They changed their football games and rerouted them to be able to make sure that they were able to play us in the last game
Right.
that they played us. Whether or not
Because-
that's able to do, but they did that.
And I asked
They
that
owe
same
us then.
question, if we could move it, but I'm not sure we can, but we'll discuss that. But luckily for them, it happened early in the season. Unlucky for us.
No, it was just
happened
2
at the
weeks
end.
ago. It was just 2 weeks ago.
Okay.
So how are we going to know that our Montoursville football team are going to be able to play in their district playoffs to be able to make sure that these seniors are going to be able to make sure that they have their district playoffs games that they earned and that they
Okay.
played
All right.
and that they did
I'd
everything
already-
they were supposed
Jenny,
to do.
I already spoke to that. We will be discussing this later. Just stay on the call or stay on the webinar and you'll hear us discuss it later.
I will be on here until you guys shut me off.
Okay. All right.
Thank you.
Okay.
Mr. Schimmel,
Yes, sir.
as the night wears on, we still have well over 200 participants from the public that are on this meeting. I think a lot of them would like to know if a motion will be made tonight and a vote taken by the board to amend our policy regarding our health and safety policy. If a motion will be made and we would take a vote tonight to amend that policy, particularly regarding keeping the kids in school. I would have an interest in that.
Yeah, Bill, and earlier, and that's part of what's driving some comments is that I told the public that we would be addressing that tonight. I can't predict whether there will be a motion, but it's an agenda item and that's why there's public comment on it now. So, I mean, something tells me, yes, there will be some kind of a motion on it, but it's on the agenda.
All right, thank you, Dave. Yes, there will be a motion.
Okay.
Okay, seeing many more hands now. I'm going to allow Mike and Barnes to speak.
Can you hear me?
Yes, I can.
Okay, this is Jill Barnes, Miken's mom. I am here. I've heard so many comments about the extracurricular activities, all of the different. When are we going to focus more on the basics, educating these children? That is the main objective for me. I understand, I respect all the sports people, I respect it all. But what I really want is a good education. We have had Montoursville, it has produced so many good, we have very, very good curriculum that comes out of Montoursville. That's what we need to focus on. And we've been listening to this for hours now, and I really haven't heard anyone focus on that. And basically that's my main objective. I get the extra things, I get all of that, but really we need to educate these children, the kids. All right, that's it.
Thank you.
I want to thank you for your comments because that is exactly my sentiments education first, and then we'll go with the sports, because I do believe the sports are important also, but it has to be about the education first.
Let's remember this was a work session tonight with a rather small agenda, but the topic of the day is school closing and sports. So that just happens to be the hot item of the day. Next week, that may not even be an item to be discussed.
Okay, moving down. We now have Chad.
Hello.
Hello, we hear you.
It's Chad Eberhardt, 300 Chestnut Street. Just have a couple thoughts. I want to thank you for being focused for so long. Appreciate that. But just a couple thoughts about the policy that we're following. So I understand that we're using the Department of Health and Department of Education guidelines, and that we're looking at the column that says we've got 2 positive cases, and then we're following through with now 5 days out of school because of that. I understand all that. We have now contact tracing from those 2 individuals that I believe the number was around 150 students or students and faculty maybe that are now part of this circle of contact tracing. So my understanding of those policies are that we are closing the school for the 5 days because of that. But to say that we're basically quarantining all kids that were not in direct contact does not seem like that's in line with the policy or the guidance from the Department of Health. So my question or maybe suggestion is to look at your policy related to the kids that were not directly positive or directly contacted with a positive, and how are we handling those kids, whether it's an extracurricular activity or it's the education. If you've decided to close the school, that is what it is. They're still getting some education. With the extracurricular activity, I'm not sure where the policy is that says we can't allow them to continue to have their extracurricular activity if they weren't in direct contact with any of the positive cases. So I'm anticipating kind of a question about that or an argument about that, because it has already happened. It seems as though we've already exaggerated or not, maybe not exaggerated, but we are being very conservative with our numbers and saying that in the shop class, we can't say for sure that a kid was or was not within 6 feet for 15 minutes or longer. So we're taking that whole class and saying, okay, they're now in the contact tracing. Correct? Am I understanding all this correctly so far? Anyone?
But Mr. Taormina explained in pretty good detail there a little bit ago how the contact tracing was done.
Clarify that.
It bottom line, it ended up being 15 minutes of continuous contact within 6 feet. And that was the criteria he has gone by.
Correct. So that's where we've come up with roughly 150 students or faculty, I believe is the number. Yeah. So where in the policy does it say that the other 500 or 450 or however many number of kids there are also not allowed to do anything else, which have not had direct contact with the positive case?
Well, the criteria that PDH and DOH give us says that if you're in a moderate setting and you have that number of students that are cases or number of cases, let's call it, we're not supposed to say students, and that you're supposed to close the schools for 5 to 7 days and do the full cleaning. So that's where it comes from. Okay. And that was all inherent in our health and safety plan, and that's what we're following. Yep. And that's also what we'll be discussing tonight in further detail.
Okay, and I appreciate that. You've got that policy and you're following that. But from those guidelines, I don't believe that it states that students that were not in that circle are not allowed to participate in extracurricular activities, correct?
That's
The
a
athletic is separate,
separate
right?
issue. That has to do with certifying whether that team is, whether the district can say that team is COVID-free. And if there's low level confidence that we could say that and sign on the dotted line, that puts the administrator in a very difficult position if they don't have that confidence to say something like that.
Okay, so I understand that. And so we're now to the point where we're saying, okay, we can either certify that the students that are not within the direct contact are COVID-free, or we can't, right? So we're basically saying at this point, we can't confirm that. However, we've been certifying based on the same criteria for this whole time. No, the children have not had, the athletes have not had direct contact with a positive case. So we've certified that they were good to go. And we also have the safety measures in place with all the teams, I believe, that they are testing their temperatures as well as the screening questions, wearing masks when they're together. So I think you've done a great job of putting all those things in place. I think you just need to follow that and look at that and say, okay, we've done our due diligence. We've isolated the 2 cases. We've isolated the direct contact. Don't penalize the rest of the group because of that. I think you've got those things in place. I think you have the ability to be able to make that decision based on that fact that you don't know that they don't have the virus. You don't know that they do, but they haven't been in direct contact. So you have no data to back up your claim to say that they can't participate, that you can't certify them. Based on everything you've done so far, you've created this opportunity for yourself to make a decision to say that they can participate because they have not had direct contact. That's all I'm going to say. I just wanted to kind of throw out that suggestion to follow your policy, but don't penalize the group that's not been in that direct contact. Thank you.
Thank you, Chad. That was some pretty sound reasoning there. Thank you, Chad.
Mr. Schimmel.
Yes, sir.
I just want to share some information that I just got. And this goes along with what one of the speakers was concerned about. The PIAA posted that we did forfeit the game with Loyal Sock, and that Loyal Sock will play the winner of the Athens versus Danville game.
Unreal. Don't have no idea why they'd run off with something like that. Have no idea.
I just wanted to share that information with everybody. That's where it was posted.
Thanks, Ron.
Okay, continuing down the list, I see we, okay, no, we don't. Continuing down the list, we have Tammy Reeder.
Hi, it's actually Vic Gorini, 33 Reeder Drive, Cogan Station, PA. My question is, just with that last statement from Mr. Schimmel, how does the school board or Montoursville area school district not know that we forfeited a game and the PIAA knows?
I don't know that we have forfeited the game. I don't know how they would run with something like that. It has nothing that came from anyone on this board and our administration. I think the fact that maybe they read the Sun Gazette saying we were closed, somebody down there didn't realize that closed doesn't mean your doors are closed. It just means you're going remote, but I don't know. I have no idea.
Now,
They ran off with information they shouldn't have.
Sorry. Question number 2, is that something the school board can contact the PIAA if you guys vote tonight, that they would be able to play, that these kids could still play?
Hypothetically, that's quite possible, yes.
Mr. President, if I may.
Yes, sir.
If there is a vote tonight, I am going to have to contact PIAA and find out since we went remote because of COVID, what they're going to say about that. I have a feeling they're gonna, like they've done everything else, bounce it back to the local school. But I'm not sure with positive cases if they're going to allow us to compete. That's something that's going to need to be clarified if you do take that vote.
Okay, thank you, Dan.
Okay, I appreciate that. I think that should certainly be looked into as soon as possible because these kids are on a short leash as far as when their games are going to be played, including girls soccer in their district playoff game. And I think it's just odd the school board and the Montoursville area school district doesn't know how we forfeited and the PIAA does. That's all I got. I just think that should be addressed tonight.
You know how the media likes to get the scoop first. It's probably some of that going on too.
Well, I hope you guys do due diligence and stand up for all the kids in the district and all the parents and everybody else. That's all I got. Thank you.
Thank you.
And Mr. Schimmel, to that speaker and the others, I would like them to contact PIAA and ask them. And when they find out, when they get an answer, please let us know. Okay, thank you.
I absolutely agree with that.
Okay, continuing down.
Bill and Ron agree on something. It must be late.
Okay, continuing down the list, we have J.C. Kiefer.
So yeah, I just want to help clarify a couple things because I'm not quite 100% sure what you'll be voting on tonight. But you know, I know some of the parents and some of the players that I coach have chimed in here, and I just want to say I'm extremely proud of those young men. They certainly weren't coached to do that tonight, and I know we praised some of the other kids that hopped on tonight and were really well spoken. And I just want to praise some of the young men that hopped on tonight and were, you know, kind of fighting for their cause. CJ Signor and Dylan Bennett and Isaiah Fenner, just really proud of those young men. But I do want to be clear on some things. This is a game that cannot be pushed back like some of the games previously in the season. This is playoffs now, so the winner of this game plays next week. So you can't push this game back a week or two or anything like that. So I just kind of wanted to throw that out there for whoever's listening and whatever you guys, you know, are voting on tonight. That's really not an option. District 4 was contacted today. The latest we could probably play would be Sunday. I can't speak for Vic and girls soccer. I'm sure that game could be pushed back probably to the weekend. But again, I don't want to speak for them, but just so you guys understand what some of the options are when it comes to playoffs. It is not like the regular season where you can take a week off, 14 days, what have you, and then make this game up. That's not how this situation works. So I did want to chime in there and just state that. And I think, you know, just from listening for tonight off and on, Mr. Eberhardt and Mr. Warner had some great points on the 150 kids that we definitely know are out. You know, the rest of the gang, you know, some of them are going to school tomorrow. Some are brothers and sisters. I have, you know, a couple brothers on the team where some were in school today, some were at home. So, you know, I think that's where some of the frustration or confusion with some of my players comes in with, well, you know, why can't the rest of the 500, like Mr. Eberhardt said, continue to do something, whether we're in school or not. You know, we're continuing education. So those kids could still show up. We don't even have to go into school. You know, we can practice. We don't even need to practice for 2-3 days if that's not an option. What have you? If you're going to deep clean the school or want us to stay off the property, what have you. I'm not sure what the plan is, and trust me, it's I wouldn't want to be in. I'm in some type of leadership position, but not quite the position that you are all in. So I just wanted to kind of clarify some of those things that were brought up, so there's not any confusion on when particularly football can be played and can't be played. And if there's any questions, I'll stay on if anybody wants to shoot me anything that maybe I can help out with.
Thank you, Jason. Dan schooled us pretty well earlier this evening on it, so we have a good understanding on all that. What's at stake?
Okay. Thanks.
Okay, next on the list, we have Mike Caseman.
Good evening. Mike Caseman, 109 Caraway Drive. Just wanted to follow up with Mr. Reeder's comment regarding how does the PIAA know that we forfeited a game. I'm not sure. What I took from the interpretation of the email that I received today from the superintendent, where it said, beginning tomorrow, Wednesday, October 28th through November 3rd, any extracurricular activities that are scheduled to take place during that time would be canceled. I read into that the football team would be postponing its game. I don't know if that's what she meant or not, but that is verbatim what the email to the parent said. That's all I have. Just hopefully that clarifies, or she can deny that either way. Have a good evening.
So that email is accurate. And what I have a problem with, though, is that the PIAA wouldn't communicate with our athletic director and to confirm something. So they ran with an email that, as far as I'm concerned, they shouldn't have run with that. But it is what it is.
I don't believe that email was sent to the PIAA, was it, Christina?
They got a hold of it somehow.
It was not sent by me. I sent this particular email to parents alone.
Yeah, it got forwarded. You know how the internet is.
Okay, next on the list is John and Patsy.
Good evening. I'll keep this brief. John Schmoloff for Eldred Township, Baxter Road, Montoursville. I really just want to thank everyone and also I know it'll be a tough decision. The recommendations were made by the health department, and they were not mandates, they're recommendations. All the kids put in a lot of hard work and effort, my son included. My son Zachary is a senior. I just hope they get a chance to play at least one more game, and hopefully you'll take that into consideration. I agree with the previous parents who voiced the same concern along with the players. So I appreciate it, appreciate your time. And again, it was a recommendation, so please take that into consideration. Thank you.
Thank you.
Okay, next is Gina Weber. Gina, are you out there? Unmute yourself.
Oh, sorry. Can you hear me?
Yes, we can.
Gina Weber, 152 Heim Drive, Eldridge Township. I got Hunter under some difficult situation. I did put him with JC Kiefer just because I seen what he did with my special needs son last year. That was a senior. I will tell you, the football team has helped him through this hard time, and it tore me apart for him to call me in tears, knowing that his season was done. He's doing wonderful in school. He's pushing, to pass his classes just so he can stay eligible to play. No, he's not a starter, but he still looks forward to the Friday night games. He still looks forward to the Monday night games, and the team and the coaches have given him role models that he's 17, he's a senior that he hasn't had in his entire life. And I wish you would take that into consideration. I'm willing to get him rapid tested if need to be, and I'm pretty sure a lot of the other parents would do the same. That's about all I have to say but I want to say thank you, Tracy Peipher. You've made a difference the last 2 years of my kid's life. Thank you. That's it.
Thank you, Gina.
Okay, next on the list, we have Kelly Kimball.
Hi, this is Nathan Kimball, the spouse of Kelly Kimball, 313 North Washington Street. And I just wanted to reiterate, I guess, or reemphasize some of the comments that J.C. Kiefer had made earlier. I'm the cross-country coach for the school district, and our district championship meet is this Thursday. So we're literally 2 days away from the culminating end of our season, and possibly extended if we have athletes go to states. But I can't, the thing that I wanted to just speak up on is just in support of the athletes that have worked so hard to get to this point. It's been a lot of dedication since July 4th. I've had athletes running with me. 2/3 of the team, I would say, has been running with me since July 4th, screening every day since July 4th, going through the pandemic since July 4th, trying to get some positivity and some success in their life. And I just wanted to speak up on behalf of the team, so that way, if any way, shape, or form, whatever decision comes out, I just want the board to know that we have athletes that, they have to put in the academic side of it to be eligible to be an athlete, a student athlete. And to take all that away, I just feel would be a crime against them. And that's all.
Okay, next we have Christine Conklin. Just 1 second, sorry about that. Okay, Christine, are you there?
Hi, this is Christine at 15 Cedarwood Lane. I'm a new voice in tonight's meeting with a similar message for parents that have spoken all night long, and administration for all the time you've invested listening to the Montoursville residents and students. Just wanted to say, in support of the athletes and all the students academically, when we wrap up things tonight, I speak on behalf of my son on the football team. I'd really like the administration and board to reconsider their decision, the healthcare policy, and try to come up with a way to let the soccer team play Friday night, the cross country, the football team play this weekend. So thank you for all the heartfelt consideration, and just hoping there's further discussion on how we can move forward safely and achieve letting these kids play out their dreams and play on this weekend. So thank you very much.
Thank you, Christine.
Sorry, bear with me for 1 moment. Okay. Next on the list, we have Christy Livermore. Okay, Christy, are you there?
Can you hear me?
Yes, we can.
Hello? Oh, okay. Sorry. Thanks for taking the time to listen to me again. First, I want to say my prayers are with the first two children and their families that tested positive. I can't imagine. I don't want to imagine. My heart goes out to them. Second, I called the Department of Health today because I'm not very patient and waiting and wanted some answers. And this is what they had to say. Because my son Gavin was a contact person, he's supposed to stay in his room, text me when he needs to use the restroom. I have to leave food at his bedroom door. If he needs to be out here with us, he has to wear a mask and he has to stay 6 feet away from us until next week. Mr. T, I know Gavin respects you greatly and he's come to you and talked to you for different things. I'm sorry, just a second. I've asked him because he was in the class, but he said he was not near said child, but for a few minutes, if even that, and definitely more than 6 feet away from him. So I know that you're just taking it by because they move all over in the wood shop. So please, if you wouldn't mind just reaching out to him and to the families of the children that are in that class and see if their children are in the same situation. That's all. Thanks.
Okay, continuing down the list, we have Mark Oberheim.
Okay, it's Brenda Oberheim. My phone had died earlier, so that's why I wasn't there for the rest of the conversation on the in-person meetings. Again, I wrote it all down and I'm going to talk quickly as to not take any more of you guys' time tonight. We all know that working remotely a lot of the time is not a good idea if you're in charge. So I appreciate you all affirming that we will be getting back to the in-person meetings as soon as possible. Also, when we were initially discussing all these things, I asked the board to err on the side of caution to not just shut us down for 1 or 2 cases. So that was one of my original requests. Also, there are false positives. There's many of them. I have a friend that's a doctor at a local hospital, and she said it happens frequently. So where some people are saying, well, I'm so afraid of a false negative, I'm afraid of a false positive that will put my kids' education in jeopardy. Also, the conversation with Scott Metzger and Christina Bason. I do appreciate Scott calling in and giving us his input. I think he's very informative, and I think that, he gets his information from good, reliable sources with his job. So that being said, I don't want him to be cut short or cut off when he is trying to speak. Also, there was a question, and I think that it came from Christina Bason to him saying, did you say that Kamala? And I don't know if that was appropriate, but bringing politics into these meetings probably isn't the best thing when it comes to, calling someone Kamala and maybe taking a side on Democrat or Republican. But that does lead me into the part that you were saying to Isaiah that it's left up to the district what decisions are made. But we should make sure that the politics of the people running the district match our district well. So if we are, you know, if someone's trying to run the district from a Democratic point of view, and the majority of us that are from Montoursville that live here don't think, you know, that way, then, you know, maybe that should be taken into consideration, because we live here and we're from here. And there's a lot of people saying we want our kids in school and we want our kids playing sports. So if it's left up to the district, like you guys said, then we should make sure that the decisions made for our district match our district. And that's all I have to say. Thank you for your time.
Thank you.
And we have iPhone.
So that's Jenny Miller again. So I just wanted to just throw this out there. I know you guys have many decisions that have to be made, but as I stand here and I make meals for my child because he's going to be able to be home, there's many children that aren't able to have these meals. You know, I just made chili and I just made poor man's soup and I just made all this stuff. And there's so many kids that aren't going to be able to have this stuff, be able to made for them. But my biggest concern is the football team. And I know that this is a school board meeting. This is a school board meeting where we're supposed to be able to find out whether or not our kids are going to be able to be in school. And it's difficult for you guys to be able to make that situation or that decision. But I just, I sat here for, what is it? 3.5 hours now, 3 hours, 4 hours we have been on. And I just hope you guys understand that kids want to play sports, and we've all been to Walmart. We've all been to Wise. We've all been to Ollie's. We've all been to Sam's Clubs. Everybody has been to those different places, and we've all done those different things. So I just hope you guys make the right decision.
Thank you, Jenny. Okay, Sebastian, go ahead and close it.
Yep, we're good. I don't see any other hands.
Okay. Guess we're ready to move on to the action items. And Christina, do you want me to do the agenda, or are you okay with doing it?
No, I'm good.
Okay, you look a little tired. I wonder why.
All's good here, Dave.
All right, walk us through it.
Under General G1, approval of an addendum for the agreement between Montoursville Area School District and Warren County School District.
Motion to approve out there?
Move to approve.
We have a second. Second from Dottie, okay. Any questions on it?
Yeah, I have a question, Christina. Help me out here. Can we buy directly from eDynamic Learning instead of going through Warren County School District, or is that something that would not be cost efficient?
I don't think that it would be cost efficient. So that's why we are contracting with them. It gives our staff the ability to teach this particular program.
Okay.
It's one class. It's just for one class, Ron.
Okay, if there's no other questions, all in favor, say aye.
Aye.
Aye. Aye.
Aye. Opposed? Ayes have it.
Under personnel, P1, approval of the following substitute custodian for the 2021 school year, Amber Fry, at a rate of pay of $10.50.
Move to approve.
Second.
Any questions? All in favor, say aye.
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 Opposed? Ayes have it.
P2, approval of the following addition to the exclusive sublist for the 2021 school year, Rebecca Hall in English.
Move to approve.
Second.
Any questions? All in favor, say aye.
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 Aye. Opposed? Ayes have it.
P3, approval of the following addition to the extracurricular activity advisors for the 2021 school year, Rebecca Hall, with 2 positions, one as drama director and one as lighting director.
Do a motion.
Move to approve.
Second.
Any questions? All in favor, say aye.
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 Opposed?
Christina, sorry.
No opposed,
Christina,
ayes have it.
Can I make a motion to lump the next P4 through P8 together for a vote?
I would request that you not do that for P7 and P8. You can do
Okay.
5 and 6.
Okay, 5 and 6 then, please.
All right, P5 and P6, please. Consent motion.
Move to approve.
Second.
Any questions? All in favor, say aye.
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 Hold it, hold it,
Opposed?
hold it. I have a question.
Oh,
Can I
sorry,
ask
Ron.
my question now?
Yeah, sorry, Ron. It's getting late, so go ahead.
Yeah, let's not get in too big of a rush here.
Well, that was a lot of background noise. I didn't really know what I was hearing.
Christina, I'm kind of curious on P5. This position won't be effective until the end of the 2021 school year, and it's to be determined. Could that be explained?
Sure. This individual is already currently employed as a teacher. And when you are in that profession, they can keep you. Your home district can keep you up to 60 days. So we need to approve her so that she can come in, but her employer has not provided when they can release her. So it will be determined about when she will be released. She will share this, that she's been approved, and she will share this with the employer, and then they will determine whether they wish to hold her for the full 60 days or they wish to release her sometime sooner.
Okay, thanks. That explains it. I was curious on why that was to be determined.
Yep, that's why, Ron.
Any other questions or discussion? Okay. All in favor, say aye.
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 Opposed? Ayes have it. Quick question. Did we do P4?
We did not.
Okay, let's jump back there.
All right, can we just go back real quick? The original omnibus motion was for P5 and P6, and I think that's what everyone had voted on. So I think that last vote that you all did was for P5 and P6.
Yeah,
that would be correct.
Correct.
Back to P4. So P4, P7, and P8 are all individually being considered
Yeah.
now.
Yep.
Okay.
Yeah.
Just wanted to confirm that.
P4, approval of the following addition to fill long-term sub position, which would be Victoria Stetz in art. And Victoria did come in for us this year at the beginning of the year, and she will be here until Ms. Holly Fuller arrives.
Move to approve.
Second.
Questions? Okay. All in favor, say aye.
Aye.
Opposed? Ayes have it.
P7, approval of a retirement from a member of the professional staff, Mr. Michael Sillo, in physical education, Mr. Sillo has given us 20 years of his time assisting our students and creating the citizens that they become. I think we're all blessed to know Mr. Sillo, and I do appreciate the professionalism that he brings and the extra. He works extra all the time for us. He's always volunteering. He's always willing to help. And I know it's late, but he deserves that credit.
And I'm just going to piggyback right on what Ms. Bason said. Just want to wish you, Mike, the best, and thanks for all that you did for our district.
Yeah, Mike's a gem. Mike is a gem. Okay, do we have a motion?
Move
to approve.
All right, Dale moves. Jen, you want a second? All right. Any questions? All in favor,
Just a
say aye.
comment. I want to echo. I want to echo what everybody else has said. Mike, best of luck in retirement.
Mhm.
You deserve the best.
Mhm. Okay. All right. All in favor, say aye.
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 All right.
Aye.
Opposed? Well, we probably wish he'd stay and say, no, you can't leave, but we can't do that. So ayes have it.
P8, approval of the following changes to the coaching staff for the 2021 school year. Mr. Craig Weaver, senior for girls basketball JV coach with a stipend.
Move to approve.
Second.
Questions? Discussion? Okay. All in favor, say aye.
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 Opposed?
God, I'm a no.
Ayes have it then. All right, I guess that the written agenda items. Now early on, I talked about the couple of items, one particular being the in-person versus virtual meetings, having that as an agenda item, and whether there's some motion to come up with. I think we've seen tonight that with 200 and some, push 275, I think it peaked at or something. Wow. I don't, if we have a light agenda with nothing happening, no problem in person. And we don't want to be bouncing around like Ricochet Rabbit. So I don't know what to do with this here, folks. This is a safe way to do it, at least if we have an issue where we have.
Dave, I think, Dave, I would like to make a motion that you look at options that the board might have to get back to doing some sort of in-person, and I'm going to say as soon as possible.
Yeah.
May not be till December, may not be till January, but if you would evaluate how we can get back to in-person. I know you've done a lot already, Dave, and there's reasons why some areas won't work out, but I'd like to make a motion that you, or if you want to establish a little subcommittee, but work on getting us back to in-person.
Well, certainly that is what I want to do. And then when I saw the high school auditorium and I thought, oh, wow. And could you imagine having tried to do tonight's meeting in the auditorium? It just, no, we'd have been turning people away, and we don't want to do that. So I don't know what the solution is when we have well over 200. I mean, do we assume that not everybody will come out, even though it's a hot button item? Do we assume we're going to have 200 and some come in the door? I don't know.
Well, we have a motion on the table. I suppose that has to be, I was going to make a different motion, but I think we have to address Dale's motion first. I think you've already done. Well, we have to see if we have a second and then we can discuss it.
All right. Was yours a second, Dottie?
No.
Oh, okay.
I will second it just to
No.
get questions, yes or no.
What exactly, give the wording of that motion again, Dale?
It's just to have you start to develop potential options that the board can get back to in person. And you could, bring something up at November's meeting, December's meeting, but it's just to give you the authority to start to work to get us back to in person.
Let me ask you,
I think Dave has been
what
doing that.
kind of features would you want the in-person meeting to have besides the, yes, there's going to be the board there and room for public, but in terms of interface with the public, interactive, what do we accomplish? Do we try to get that too, or just leave it as a, because as it is right now, we just broadcast it, but you're just watching, you're not commenting. Do we want to have interactivity?
Yes, and I just think, you've evaluated the high school auditorium, and I think that we would have been able to do it in there, but the facility is being utilized by the band. And the takedown, reset up of that as an instructional space, just the cost to do that, I saw as prohibited as you did, Dave. But, I look at the middle school, there are areas, whether it's in the commons, the cafeteria area. I mean, you could look at Lighter and look at the all-purpose room. There's facilities, that are large enough that could be set up, I think, to accommodate maybe 100 people. I have no idea what those areas have as a capacity, but I guess that's what I would want to have evaluated to make sure there just wasn't any other options, for us to do it. But no, I'm not in favor of purchasing more equipment to be able to. I think streaming it live, as the way board meetings have been for some time. I am correct on that, right?
Right, yeah, it's streamed, but that's it. Yeah, no interactivity.
Yeah, I think the interactivity, although there maybe is some desire to be able to do it for everyone that can't make a meeting, that's not historically what board meetings were about. It was the face-to-face with the community. Now we're using Zoom as a patchwork because we don't have that. But I'm sorry, I'm isolated from the community. When I'm sitting here in this meeting, on my iPad, I don't see any of the community. They maybe see me, but I don't see them. I can't dialogue directly with them and see their facial expressions. So I need face-to-face. I don't need television, in terms of how it is. So I want to see, is there some space within our district that we can socially distance, mask, and accommodate more folks than we can in our current boardroom.
Well, and I would say ideally it would be a minimum of 75 to 100. I mean, if we can't live stream and have the interaction that way, I guess we want to see what the greatest minimum number of attendees would be.
But these are exceptions, and I'll go back. Excuse me, Ron. But my previous time on the board, we used for the most part, it was the library and the high school. And there were times where it was packed and there was no social distancing. But to say we had crowds that exceeded 100, I just don't think that happened.
Well,
so
I just think this year with
think
COVID, I think we could have ongoing large meetings, in terms.
I just want to say, I cannot support not going back to in-person meetings. And I'll tell you why. One of the main reasons why. We had approximately 240 community members show up to this meeting tonight. This was a hot topic meeting. It still is a hot topic meeting. And we had at least 240 community members show up. Out of them 240 community members, approximately 45 of those members spoke. So if we continue to live stream, and so people can watch the meeting, and anybody that feels that they need to speak could attend the meeting, like tonight, in the high school auditorium, social distancing, there would be plenty of room. Because even though we had 240 people, we didn't have 240 people that wanted to speak. They was interested in what was going on. So that's why I cannot support dragging these Zoom meetings on any further.
But there's problems with meeting in the auditorium. The band, it's all set up. It's going to take like 4 hours of manpower, which is money, to set us up for that meeting. I like being able to hear the people. I like this format for now because it enables the parents to get on and participate when they may not be able to come to the high school, especially we're coming up on winter months and you're going to be snow. We won't have to cancel meetings for snow or roads. And we'd have to have security there. They'd have to be masked. What do you do if they don't mask? Who's going to tell them they're going to be arrested for trespassing? Who's going to take their temperature and do the COVID check before they come into the meeting? And what if they come in with, I've seen it at Walmart, you hand them a mask and then they just walk around holding it in their hand. There's just, I just think this is working. We're getting a lot of participation. It's not forever. I want to get back once the COVID is over, but it's here for a while, at least through the spring. In the winter months is not a time to start meeting in person when the case counts are going up. It just isn't. Education, our jobs, we all do what we have to do, but this is working and I don't see a reason to change it.
Dottie, you do realize that we spent over $18,000 for the temperature things that they would walk by and when they come into the meeting, correct? You do realize that, right?
But I'm not sure that gives you any, I don't know. Does that give you an immediate temperature? Who's going to be standing there to watch it? Somebody still has to be standing there to make sure nobody's coming into the meeting with a fever. Somebody still has to man it.
True.
And the problem being what?
It's money. You're going to have to pay a security person or somebody to come. Our finances are in trouble right now with all the extra costs with COVID.
Didn't mind paying over $18,000 for systems to do that when we could have had handhelds for $200 a piece. So I don't think your argument on the cost of having a person watch that is legitimate.
Well, that's a different topic. I'm just saying, as much as you insist on going back, I will insist on staying with the Zoom format because it's working. And your Department of Health tells you that you are supposed to be working remotely as much as possible. And there's no reason not to continue working remotely when it's working. Just so that I can see somebody's face, I can hear them very loud and clear. Right now, the way this is working, and I think I'm hearing them a whole lot better than if they would be behind a mask.
Yeah, wondering if you would be able to see their facial expressions behind a mask was my first thought. And I'm going to side with Dottie on this. I think that the Zoom meetings for right now are working until this, we're spiking right now. We were going down, it was looking good, and now we're heading back up. 2,700 cases today. I think for now, this isn't forever. This is not a forever thing. And until it's under control, I'm fine with the Zooms for right now.
Well, and I guess the setup argument, if it's going to take 4 hours to change the seating, and I guess as I think about it, then we would need sanitizer and bottles that people before they sat and after they sat would sanitize. I mean, so we could look at all the logistics like Dale suggested, but there's kind of a long list of hoops or negatives associated. There's benefits obviously, but there's a lot of potential problem.
And I would agree with Dottie, but for different reasons, not so much the health concern. Personally, I like in-person meetings. That's my preference. However, when Dave put out his email listing all the work that needed to be done to set up, tear down, and then sanitize after an in-person meeting in the auditorium, again, that's time. Time is money. Not only that, but a lot of people are able to attend these meetings when they're held virtually. I mean, they can sit here, in their bathrobe and slippers, and I'm sure some of them did tonight. But if they have young children at home, they can be home with them. I think it's a great convenience to those who want to attend the meetings, but for whatever reasons cannot attend them or don't want to have to go out. And as was said earlier, with the winter months coming, I think for right now, I think virtual is the way to go, but I will emphasize, I prefer in person. Thank you.
Well, I think we all prefer in person. It's just, a matter of safety and money.
Well, maybe we set a goal of March, or you know what I mean? Like especially like we don't want a ton of people in our building. I mean, even though it's mostly aerosol, in terms of coming in and sitting on the surfaces, using the bathrooms, things like that, I guess, especially in the winter months, like you said.
Certainly something we're going to revisit as our numbers go down and the vaccine comes out, et cetera, et cetera.
I'm kind of curious. We was given the number of 4 hours to clean up after a meeting. Is that the length of time that is spent cleaning up the auditorium after every day when the band's in there, or chorus is in there, or other students in there? Is that the length of time that is spent during every day?
My impression is that's left set up that way, Ron, because that's where band and orchestra are doing their class, but because they can social distance. Now, Dan, is it set up that way continuously?
Yeah, I don't think it's the 4 hours to just clean it. It's the 4 hours they're using the entire stage from front to back. So it would be the 4 hours to take the chairs, the music stands, the conductor's podium, plus the cleaning of all that, and then resetting it back up. It's bringing in the tables you would use. We're using it as cafeteria tables right now. So it would be cleaning those after school, cleaning them again after you use them, putting them back, setting them back up. So it's not just 4 hours of cleaning. There's tear down and set up too.
How much time does it take to move 9, 10, 11, 12 chairs to the front of the stage?
I didn't come up with the 4 hour estimate. That would be a Joe question.
I mean, you don't have to clean off the whole stage and move everything off the whole stage just because we're having a meeting. We could have the meeting in the front of the stage, and everything behind us could be left intact.
Yeah, but from the curtain to the front, there's probably 30 chairs and music stands, plus jazz bands set up on risers. It's more than you. You have I think you sent the picture out, Dave.
Yes.
I can get a different angle of that if you want, so you can see, or
As board members, you're welcome to come in. We'll put you through the screening. You wear your mask and you can take a look at it yourself and determine whether we're lying to you or not. Those are estimates on time. I don't know what else to say.
Folks, we're just discussing what my motion is asking Dave to do. Just start to evaluate where or when we can get back to in person. Why are we debating it tonight? My motion is just to have Dave start to investigate this, to put it in motion. It may not be until next June that we can do this, but have a process begin that we're going to get back in person. Come on, guys.
I think the issue, Dale, is that Dave is working on that, and he has been working on it. I don't oppose him.
I know, but
on it.
There seemed to be some division about, is that his role or not? And I'm putting it in the way of a motion that will have a process that Dave can evaluate these things. Yes, he's already basically said the high school auditorium is out for now.
Well,
but there may be other options. If there are, there are. If there aren't, there aren't.
I wouldn't say the high school auditorium's out. It's just the implications of doing it, and are we willing to accept the implications of using the high school auditorium with the moving of a bunch of furniture to the rear, bringing in tables, setting them up. As Dan said, you got to clean them from the kids spitting all over them or whatever. You bring those tables in, you set them up for us. You mic them. Every one of them is going to have a mic. They're going to be 6 feet apart, and we need to be able to tie that sound system in such a way that it enables Dottie to hear. That's just reality. And then you have a camera you're going to sit that's going to live stream the meeting. It won't be good quality, but at least it'll be live streamed. But Ron, you stole my thought there about saying that there are only 45, 50 people commented. So I'm comfortable we can, with that, we can use the auditorium from a participation standpoint, but do we want to do all those things associated with that? And when the public is going to be basically those that want to tune in and watch, this is not going to be a very, very good picture. It really isn't. And the audio won't be very good just because of our equipment as it stands now. That's a concern I have, I guess.
I think we got the brand new high-tech equipment there in the auditorium.
Well, there's
and as far as the live stream, Dave, the live streams from in the boardroom, the quality of the live stream video, if you look at them, the videos is good quality.
Well, they're 15 to 20 feet from us all. Now we're going to be setting that thing back in the middle of the auditorium to pan across the whole stage front, because there's going to be 12 of us 6 feet apart. I don't know if we even have enough room to space us apart that much. The more I think about it, how wide's that stage, Dan? 60 feet, 67 feet?
Probably about 60.
Yeah, I mean, we'll be using that whole stage width. So to be able to, have it back far enough to catch everybody, and then everybody's going to look rather small. And I can only hope that the audio can be patched in to send a good audio signal. That's those glitches are the ones I'm wondering about. Christina and I talked about actually McCall's Commons may be actually a better spot because we set individual chairs there. And you can set them spaced, and the lighting's better, and the sound system is right behind where I would envision we set the tables up. So that might be a better option. So I do want to look at that.
All right. If you want to go with Dale's motion, which we already have to vote on it anyway because we do have a second, I would like to add a time restraint on it, meaning that we get a decision back on the next board meeting, not wait till the end of November, the end of December, January, February, like I've heard during this discussion, because we do need to get back in person.
So you'd like something, you'd like to kind of have a report back by the 10th.
That gives you 2 weeks, yes.
Yeah. Oh, you're tough. Geez. All right, I'll work on it. If you pass it.
I'd like that put in a motion.
Right.
If
Oh,
Dale
the 2
agrees.
weeks. Thanks a
Since
lot.
it's Dale's motion, I think he has to agree to it.
Dale, do you want to amend that and handcuff
I'm
me like
generous.
that?
I'll give you a month, Dave.
I will shoot for 2 weeks. I will shoot for something for the
Okay.
November meeting. Well, and realistically,
I
Ron,
would amend my motion.
right. I don't know. We can't do anything for November, right? Is that fair to say? We really aren't there to do
Right.
November's live. We only have one meeting in November as far as we don't have a work session, correct?
And that's why I said 2 weeks.
Hey, Dave and Dale.
Yeah.
So regarding Dale's original motion, if there's going to be an amendment, Dale, you can simply make a motion, or someone can make a motion to amend the previous motion. There will be a second required, and just take a vote, and then you can go back and then vote on the original motion with the amendments.
Okay, I'd like to
Okay.
make a motion to amend Dale's motion to give a 2-week limit on getting back to the board with all the information needed.
I'll second the motion.
So are we approving an amendment or what?
You're just
The amendment first.
Yeah, the amendment, and then you can vote on the substance of the motion after that.
Okay. All right, everybody get that amendment. It handcuffs me to 2 weeks. So all in favor, say aye.
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 Opposed? I should
No.
say aye, but I won't. Was there not,
No.
was there?
No from me.
All
No.
right. say-
No from Jen.
All right. That amendment passes 7-2.
And now you can vote on the original on the motion with the amendments.
Okay. So the original plus the amendment, all in favor, say aye.
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 Opposed?
No.
Okay. All right, 7-2, ayes have it. All right. What about
I'd
revising?
like to make a motion that we amend our safety plan to up the requirements for the amount of cases that we have of COVID, still staying within the Pennsylvania Department of Education guidelines, but to raise the number that we're currently using at 2 to raise that number.
That a formal motion, Ron?
Yes, it is.
I'd like to second that.
Okay, discussion. I'll ask the first question. Raising it, what does that mean? That doesn't give any definition to the administration and superintendent that we're not telling them anything. In a sense, it's already got a 2 to 4 to 30, 32 for the high school, and so it doesn't really do anything functionally for us. I don't think, fellas. I think we need a number or percent there that will translate into a number for them to work with. Otherwise, we're just letting them decide, and then we have another discussion about that number again. If we don't, if we think it should have been different. So I think we give them a percent.
Mr. Schimmel, I would agree with that. They need to have a number translated by percentage. As far as the high school goes, Mr. Taormina can correct me on this. I'm thinking 610 students, approximately. And
561.
excuse me?
561.
Oh boy, that dropped. Okay.
It's not counting the wall students. They're not in the building.
Okay. And this is certainly open for discussion, but I'm thinking like 2%.
I do have one question, Dan. That 561 is just students. The PDE guidelines, doesn't that include faculty in the building also?
Yes, it does. It includes
So
all
that would
persons
raise,
within the building.
that would raise that number. Pardon me?
It would include all persons within the building.
I mean, Bill, a number
Okay,
of.
thank you.
Did you say 2%? Go ahead, Ron. Go ahead.
So we're allowed 5%.
I was going to ask Bill the same thing.
Did you say 2, Bill?
I was going to ask Bill the same thing, 1%.
It's Ron's motion. I support it. And I'm just, obviously, we're all going to weigh in on this, I'm sure. But I'm thinking like 2%, you know, a number that would be reasonable, even if we were, you know, we're looking at 2%, maybe it's somewhere between 12 and 15 persons that would have to test positive. To be honest with you, I'm in favor of a number considerably higher than 2.
Well, then isn't 5% what we can go?
Yes.
It depends on how
Yeah,
you. It's or, not.
That's the other figure that PDE uses.
That's right, 5%.
I think the less than 5%.
And I think they put that there for smaller schools to help you arrange it. But the 2 to 4 is there for whether you're low risk or moderate risk or substantial risk. It's just what you do with it. The lower risk is just closing for 3 to 5 days instead of 5 to 7 days.
I'd like to add to my motion to have it at 2%.
So 2% at the high school is a dozen. At lighter, it would be 8 or so, 8 or 9. McCall, 9 or 10. And what, 4 or 5 out at the Valley. I guess my question is, if we have a dozen have discovered within a very short window of time, a dozen, or here's the other thing, is that a running total over a certain period of time? Or is that at any given time? Or how do you tabulate that? And here's the other thing we got to think about too. Just with 2 cases, we had upwards of 100 plus contacts. So if we run that number up too high, everybody in the school is going to be a contact. We're closing. So we don't want to go crazy, I think, with the number. I was thinking maybe 1% myself, Bill, that gives you 6 at the high school. 6 at the high school, and when you do contact tracing from that, we'll be pretty astounded at the head count.
And I understand what you're saying, Mr. Schimmel, but I'm just, I think we're all in agreement that the 2 is a ridiculously low number. And I just think, I think 2% is in line. I do. This is, I won't get into it politically. I just think it's being made out to be far more than what it really is.
So Bill, do you think that we as a board know more than epidemiologists for the state that are setting these guidelines for us?
I'm not convinced.
That we're going to change them?
Dottie, I'm not convinced. My question to you would be, how many people do you know that have contracted this disease and they're under the age of 20 years old and they have become seriously ill? I personally know of none, 0.
Well, it's not necessarily the kids, it's the community we're talking about.
I
And
agree.
those kids in the last meeting that are going home to parents who are immunocompromised.
Right.
Well, and I guess one question, do we not want the school deep cleaned after any positive case? I mean, is there a required at least a certain days of, I don't know, do our people do the deep cleaning, and how long does that take? Do you go through and mist every room and every countertop? I mean, the days is one thing, but it seems like we would want it deep cleaned after any positive case was identified, wouldn't we?
What we currently do.
If you remember,
At-
we was,
At 2%, you're at the high school, I mean, you're talking 10 or 11 positive cases over a 7-day, a 14-day period, and you're going to close that entire school down after listening to parent after parent explain to us how traumatic this is for their child's education. You're going to shut out 550 students because 10 students were positive.
Because if you don't,
I
it's going to
think
grow
that number is not
exponentially.
too low.
It's going to grow exponentially. You do it to press pause,
No.
so that you don't end up
No,
with
it's
100. Look at what happened at colleges that don't.
Okay.
Susan.
Yeah, and they stayed open.
More welcome to just close for 3 to 5 days instead of 5 to 7. We raised to go back to school so our kids could get the education. We raised our limit to that substantial list when we're we're supposed to be moderate. So we moved it a little bit. So I would more would approve it better if we would just go to that low on the guidelines and say, okay, if we have 2 to 4, we'll close for 3 to 5 days instead of the 5 to 7 in the moderate risk. But then if you have 5 or more, you're going to close for 14 days to allow that super spreader event to stop, to nip it in the bud. It's late, sorry.
How do you know you're going to have a super
late. And I'd like to
spreader
say
event?
too, we employ over
Yeah.
100 people, and are we even considering our own staff, who I know a lot of them, well, look, Mike Sillo's retiring. We've got a lot of staff that are close to a retirement age that may be health risk. Or have any of you even thought of them?
Sue, I just want to bring up the point.
I've thought of them, Jen, but you know what? You know, I have teachers in my family, 5 of them, you know that. And I do understand that, okay? The risk involved with teachers and staff, I get that. But, you know, agree with him or disagree with him. As Scott Metzger said earlier tonight, if we're going to keep, you know, a couple cases here, a couple cases there, we shut the schools down. We might as well shut them down permanently, okay? We might as well just shut them down permanently. And while we're at it, what the hell, shut down the economy too. You can't go on like this. You can't go on indefinitely.
I just want to say a couple things here real quick.
I just want to make.
I just want to,
Okay,
let me get in here quick. Sue brought up the point about the deep cleaning and the misting the rooms. If you remember, Sue, we were told that happens every day to every room, to every school in the district. So the misting part of it, and I realize that isn't total deep cleaning, but the misting part of it, we were told, is done every day after the classes. And the other thing I would like to say is, yes, we have thought about, or I have, and I think most of us have thought about the staff also. But you have to remember, our number one priority is the students. And for the students to be suffering in their education, and that's my main priority, to have the students suffering in their education. And let's face it, they suffered last year. And now, if we don't do something, they're going to suffer again this year. And sooner or later, it's going to be too late to catch them back up. And that's what I'm concerned about.
But if
And
we
I'm gonna
don't
agree with you,
nip it in
Ron.
the bud, we're going to be in complete remote for the rest of the school year. If we have to close down for 3 days here and 3 days there to stop the super spreader, that's better than having to go remote for the remainder of the school year.
And
We're at a
if I could
point now,
make one comment.
Epidemiologist at the Department of Health.
Yep. One of the things that I heard tonight that just set me back, and I hadn't even thought about this, there's nothing we can do about it, but this contact tracing that we're doing, you know, if I'm a student and I'm wearing my mask every day, and I just happen to luck out to be in the same class as someone that turned positive, and my seat was 6 feet away or less than maybe 5.5 feet away from that student, and I didn't talk to that student for 15 minutes, but I was in that room with them for more than 15 minutes. I am now going to be sent home, and I have to stay at home for 14 days. I did everything right. Why am I wearing a mask if in that scenario, I am going to have to still be excluded from school for 2 weeks simply because I sat within 6 feet of this individual? The World Health Organization said 3 feet was fine. Just because the CDC said that 6 feet, that's our standard. Well, 5.5 feet, oh no, that doesn't cut it. And this time period, the CDC, which we're not following now, but they just said, oh, that 15 minutes, it could be 5 minutes here, 5 minutes there, or let's just make it 2 minutes on 7 or 8 different occasions. That's 15. You're now within close contact. You've got to be, if you're in school, you're going to be sent home for 14 days. And you've got to have 2 negative tests before you get back in, or you're going to sit out those 14 days. Again, there's nothing we can do about it. But if I were a student, I would be so frustrated because I played by the rules of the game and I got sent home for 2 weeks. Amen.
You know, I think we heard it loud and clear from the parents tonight. Okay, we heard it loud and clear. The precautions are doing more actual damage than the potential damage that the virus could do. We're hearing it. The precautions are doing more damage. The damage is real. And my job here is to represent what the parents want. Get the kids back in school.
If these 140 or 150 contact tracing cases are followed through now with this 1 or 2 positives, if masks do any good, we really shouldn't be seeing any other positive cases out of this. And statistics are telling us that we're only going to see maybe 3%. So if we've got 100 students, we're going to get 3 of them that'll turn positive just because that virus was so viral. The mask didn't do any good. The distance didn't do any good. That student was susceptible. But again, statistics are telling us that student is not susceptible. They are the least susceptible in our society. And yet they're the ones that with education, we're hammering them. We're hammering them.
If masks are so the fix-all, then we as a school district need to make sure our staff makes that, they can't be letting students get away with not having the mask on. If that's the fix-all, then our staff needs to make sure it stays on. And it's not just our staff that needs to do it. It's parents need to support us as a district and tell their students, look, you need to keep your mask on at school. If I hear tell of you not having it on at school, then you're going to suffer the consequences. And those consequences should be at school also. And if we have staff that aren't supporting that because supposedly masks are a fix-all, then those staff need to be reprimanded. Because when I hear parents calling me or messaging me saying that their student come home and that they was in classes where the teacher did nothing to students that had their mask off, that concerns me. I'm not saying we have many teachers that are like that, but one is too many if masks are the cure-all. So what I'm saying is it's not only going to be the staff at Montoursville area school district, it's got to be the community, the parents, and everybody. And parents need to stop sending their kids to school pumped up with Tylenol, and by noon they get a temperature and go to the nurse's office. That has got to stop.
And as one parent noted on here tonight, if the parents as a whole will know that if we follow the guidelines, the school's going to close down. If we get 2 to 4 cases or 5 or more, we go to remote for 14 days, then maybe that would help them to realize that they need to wear a mask. But if we change our guidelines because we don't want to close the school for 3 to 5 days to deep clean and do what the experts tell us to do, they're not going to follow the expert advice either. We're asking them to follow advice, but we're not following the advice and the guidelines set forth.
I hope every parent, those 240 community members, that most of them were parents, I hope every one of them talks to every one of their friends. And I hope this meeting tonight was a wake-up call that they have to stress to these students that they got to follow the mandates on wearing their mask. Whether it helps or not, I do not know. I'm not a health expert. I'm not an expert on any of it. But I will say this, if that is a possibility, the slightest possibility that it could stop us from having another meeting like this, I'm all for it.
Well, Ron, and I think the research is different masks block certain percentages of the virus. So like a good cotton 2-ply mask will block 65% of droplets. So, you know, these things might not be 100, but you know, the better the mask, the more percent of aerosol droplets are blocked, which is going to reduce the risk of infecting other people around you.
And that's another, you brought up the mask, that's another good point too, because we paid lots of money for masks for every one of these students. We paid lots of money for face shields for these students. We paid lots of money for desk shields for these students. But if they don't wash them masks that we supplied to them, that isn't doing any good either. And that's the parents' responsibility.
I think it's important to note that there's parents that aren't comfortable having their kids in school. They also have the Warrior Online option. You know, that's something else that they can do. But, you know, as Ron said, as Dale said, you know, if we're going to just shut down the school every time we get 5, 6, 7 cases, you know, we might as well just curl up in a ball, lay down on the floor and just say we're done. You know, school's over, closed until we have a vaccine, a proven vaccine. I'm going to say it again. These precautions are doing genuine and considerably more damage, in my opinion, than what this virus would do. Thank you.
I have one question. I'd like to know if we are allowed to go to 5%, why would we not do that?
Because if you have 5% testing positive, you probably really have more like 8%. I mean, that's just my guess or my thought.
Well, what does the state guideline tell us? 5%? So if it says 5%, how do you get 8%?
Because you have kids who aren't getting tested. They're positive, but they're not in the 5% positive.
I mean, I listened through all this and I'm so aggravated from the standpoint that we are allowing our state government dictate what we do as a community. I've said this from the beginning. We're all in this together. And I cannot emphasize enough how important it is for all these students to be in this school. And at the end of the day, you know, we as parents hurt for our children, all of us. All these people that got on here tonight and was speaking, they're hurting for their children. They're genuine, hurtful individuals that have gone through hell for the last freaking 6-7 months. Something that none of us even would even imagine would come into our forum and into our existence, and it's here now. And I know I move my hands around a lot when I talk, and I apologize for that, but you know, I can't help but think about, you know, all these seniors across this whole state. You know, these colleges are doing it, and there's a hell of a lot more kids in college than there is in this school. And they're playing, they're still doing the things they're doing. They're going to school, they're getting educated. There's no reason we can't do it either. You know, this is new for all of us. We all make mistakes. We all stumble along the way. But one thing's for sure is that we all agree that these kids need to be in school. More importantly than anything is their education. And there were some people that spoke tonight about, you know, being high up in the class and they're struggling. There's a lot of people that are doing that, a lot of students that are doing that, and they're struggling. They got to be in school. And as far as I'm concerned, we should take it to whatever rate we can take it, because at the end of the day, once you reach it, you're done anyway. You know, but if you continue to do this petty here and there and here and there, you know, that's not healthy either. That's not doing anything for us. It's either all or nothing. That's the way I feel about it.
Danny, the only thing I got to say about your suggestion on going up to the 5% is at 2%, the amount, if it's 12 to 15, we'll say at 2%, that closes the school. With contact tracing, it's going to close anyway before it gets to 5%. You know, you understand what I'm saying? Because we have 2 kids right now, and Dan says with contact tracing, it affected 150, approximately 150 students. So if we go to 5%, the school's going to be closed because of contact tracing long before it hits the 5%.
So when you talk about contact tracing, what good does it do to wear a mask? What good does it do to social distance at 6 feet? It does nothing for you.
It
makes
have
no sense to me.
I have no argument there for you, but I'm just saying that we need to do what we can. And if, like I said, if the mask is the cure-all, or not cure-all, the preventative all, then if there is a slight chance of that, then we need to make sure that they wear their mask. And parents needs to make sure they stress that to their child.
That can be enforced the 7 or 8 hours that they're in school, but you can't enforce that after they leave.
I agree.
You know,
I agree, and that's why I beg parents to be vigilant. And it's like I said before, Danny, it's going to take more than just the school district to keep this from going south. It's going to take the community, the parents in the community, to keep it so it doesn't go south. because we need to keep these kids in school. They need to be learning.
This contact tracing just does not make sense to me. Again, if you're wearing a mask, you're wearing a mask because someone's going to be closer than 6 feet. If they're beyond 6 feet, you don't need to wear a mask. That's why we were going to go to face shields. Why are we doing this contact tracing on kids who are wearing masks simply because a positive person got within 6 feet of them? Now, if they got within 6 feet and they weren't wearing a mask, then you want to have them tested. I just don't understand the logic behind that. And
Yeah,
I'm
it's
with you,
not
Danny.
either or
I think
anymore.
5%.
It's not either or. You're supposed to do both. Wear a mask and social distance. Just because you're further than 6 feet doesn't mean you don't wear a mask. Just because you have a mask doesn't mean you don't keep your 6 feet apart. It's both. It's not either or anymore. And that's just how the science is changing as we learn more about. And I know you don't believe that. I know that you believe in herd immunity.
No, I don't, Dottie.
But
I just, and that's my
Well,
personal
we can't
opinion.
argue
I
that.
don't
We have to
buy
follow the guidelines.
Okay, well,
Okay, so
3 feet said you'll have 92%. 6 feet said you get 98% blockage. That was a little study that some little girl did, and gee, here we are.
Jen was
okay,
gonna say
so
something.
it's now after midnight. Is there any way that we could fine tune this motion so that we can bring it to a vote? Because we have over 150 people waiting for an answer.
We have a motion that is generic, and we really need to have something with some specificity, I believe, to give the administration something more to work with. We're not helping them by just saying increase it. We have to tell them what we think is a good working number, whatever that might be. The additional thing is, if it's 2%,
I already said that I'd add to the motion 2%.
All right, okay,
I already said
2%.
that.
All right, then the next thing is the 2%. What's the working window of time for the 2%? If that's a dozen in the high school, are we saying that we can have, a dozen infected at any time, or a dozen cases that we've discovered in the high school at any particular time? How do we work that?
Well, it has to be at the same time. It can't be 2 months apart.
The current guidelines say within a 14-day period. Is that what you're alluding to, Ron?
Yeah. How do we put parameters on that? Are we just gonna have a so at any given time, say no more than 2%?
Correct.
I would agree with that, the 14-day period.
Is that within the district or each building?
2% would be per building, yeah.
Close any individual building.
Just clarifying that.
Can I ask two questions? If we're doing this building by building, what do we do when there are siblings in other buildings? And my second question is this standardized for then the low, moderate, and substantial?
Well, and that's the other thing, Christina, then what do we do when we trigger the threshold? How do we act on it? Do we close for 5 to 7 days? Do we close 3 to 5 days? How do we want to execute that? I mean, because we're sort of rewriting, we're putting parameters on what we want at Montoursville. So I think if we want to take this monkey off the administration's back, and let me detour for just a brief second. And I wish 250 people were listening to me say this instead of, I think we're down to 150. This has absolutely nothing to do with our superintendent making an error in judgment. If anything, this is a board that we just didn't know what we were dealing with, and now we understand it better now that it's his right in the face. This is what's happened here. This discussion is nothing to do with the superintendent, a fault, a failure, or anything at all. And I reject anybody that says something like that, they're all wet. They're wrong. This is about us trying to figure out how to navigate these stinky waters. So 2%.
I would say the 2% would be under the moderate, and it would still be 5 to 7 days shut down if we reach the 2% under the moderate. If the county moves to red, then I would say that it would be the 14 days out instead of the 3 to 7.
If the county went to what they call substantial, you mean, Ron? Because they got rid of that red stuff. Yeah. All right.
Well, yes.
Okay.
Okay, and then can you tell me how that 2% would work when it expands over buildings, bus routes, staff? Because if we have a situation where it would take out a certain number of staff in each building, we wouldn't be able to operate anyway.
And that's why that's why I'm not comfortable going with the 5%, is because of contact tracing would more than likely include more staff members that would take them out. And that's why I think 2% would be about. Go ahead.
If we have key employees that go down, our school nurses, for example, if our school nurses go down, the 2% will mean nothing, because we have to have that school nurse in the schools actually performing these tasks, not just these tasks, but all of the tasks that our students need them to perform. And we can cover, if one is out, we could cover, but we don't have subs for school nurses. We've tried getting subs, and I think we may have one. I might be wrong. We may have one who is a sub, but we do need to just really consider those key pieces of personnel too.
But that could occur with 1% or less.
Yes, 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 Scott, it could.
I think this is such a complex subject that you can't do a branching logic type of scenario to cover it. I really think that what we're looking to establish is a point where a red flag goes up and the board needs to be assessed of the situation and then can make a determination of the path forward, whether we're closing down. I mean, if you've got certain personnel that, like you're just describing, Christina, again, the board needs to be aware of that so that we can make a decision what path forward to take.
How do I call a special board meeting if I lose 2 school nurses, for example, and this is hypothetical, Dale, or I have a 2% that spans 2 buildings on buses, for example? How do I call a special school board meeting to establish what goes on when I have the parameters of advertising that meeting and the whole thing? Are we just going to use an exec session for that?
Christina, what about a special meeting? What about just a special meeting? I mean, you advertise it 24 hours?
24-hour notice in the paper, I believe. Brandy, help me out here.
Yeah, but if we know that, okay, so you're saying if we have a sort of a catastrophe event, so to speak, and that you would lose the nursing staff at a building, and now you have nothing. Yeah.
Or not even them getting COVID, but what if it's one of their children and they then have to use COVID days because now they have to be home watching their child too? What if that happens with staff? Not even just nurses, but what if it happens with staff who they have to be with their child because they have been part of contact tracing, which will happen because we have our students who are parents as well here in the district. So again,
well,
that really,
if that happened,
go ahead.
If that happened yesterday, what would you have done?
I would have done the same thing. I would have shut it down. It was in the policy, in the plan to do that. It would have been called to Department of Health if it was COVID related. And if it was just because they needed to be using COVID sick, as in COVID sick days, that's what we would have done. We've been saying this for months and months and months and months,
So-
that these were the scenarios that we've worked through with this.
So if a couple
Crazy, but
nurses had situations where they were out, we'd have to shut the buildings down. Is that right?
I'm sorry, Dale, could you repeat the beginning of your sentence?
If you had nurses as the staff that called off and you didn't have nurses to staff a building, do you shut the building down?
We can't run without nurses.
I just want to say, Christina, with all due respect, because you know I respect you, but we can't make decisions on what ifs. And I know you're doing the
Ron,
best
I bring
you can.
that one up only because we have 4 of them. We have 2 school nurses who supervise, 2 who are our health tech aides that way.
It's just that. Go ahead, Sue.
I was just gonna say, I think it's too late and I don't think we're thinking clearly. And I think, could we table this, do a special meeting in a week? But I think we need to decide about the sports because that's like in the next 3 days. So could I, whatever procedural thing it would take to say, I don't think we can decide all the arms about the 2% tonight, but I think the sports has to be decided tonight.
I think this issue needs to be decided before the sports, so.
Everyone, if I can just interject real quick. Ron, you had a motion to amend your original motion. That's the motion that's still pending. So the board would need to decide on that motion first to amend your original motion and then go back to the original motion from there. I haven't heard it yet, but it sounds like there possibly could be a motion to postpone consideration or table, however you want to call it. That would need to be taken into consideration after Ron's first 2 motions. So just to keep everyone on track here, that's where we're at.
Thank you, Tom.
Ron, your amendment is the 2%.
Correct.
Right? Okay. All right. Christina, besides 2%, what, I don't want to get too deep into amendments here, but what other parameters are going to be vital for you to operate knowing, without stepping on a landmine? Because essentially
I won't. I'm telling you right now, I won't do that. Everything is coming straight to you guys because that's how it's going to have to be run, because otherwise we'll be into the yes, no, and we've been here since 7. I certainly don't want that, but I can guarantee you this is what's going to happen probably when we do have to have these circumstances. So please just be prepared for that. When we have an individual circumstance happening. So I'll be bringing it all back.
Christina,
Yes, Scott.
that would probably involve personnel, which can be a personnel called fairly quickly, correct?
Yes, you're correct.
I mean, that's typically what's going to involve is a personnel issue that doesn't need to be advertised.
That's correct. You are correct. Okay. Yeah.
Thank you.
Something else I wanted to throw in here too, very early on in the meeting tonight, or might I say yesterday, because it was, I alluded to this, to my thoughts that this should be a board decision. It should not be dumped in Mrs. Bason's lap. I just want to make it very clear, as I think it has been made clear tonight. I did misspeak. It was not her decision. She was simply following the guidelines of a previously approved by the board health plan. What we were doing wasn't dumping the decision in her lap. Unfortunately, she was the messenger. So I just want to make that clear. And I think it was made clear earlier, but I just wanted to make sure everybody heard it from me. Thank you.
Yeah. Now, the ancillary thing to all this is when it comes to contact tracing. My sentiment on that is, unless Dan really can nail it down that, yep, there was definitely 15 minutes. I say if he can't prove it, move on. Don't put him in the bucket. And I'll tell you, 2 weeks ago, I was sitting at a dining room table with a nephew and a niece and family members for 3 hours talking, eating. 2 days later, that nephew turned up with COVID. None of us were masked. We were talking, we were laughing, we were eating cake, we were having a good old time. So our family quarantined for 14 days and we got nothing. The grandfather to my nephew was sitting right beside him, elbow to elbow. Nothing. The boy's little brother, right on the other side of him. Nothing. So I'm telling you, I don't know that it's that easily transmitted. Sorry, that's anecdotal, Dottie. Sorry, but holy cow. I mean, there it was, all of us sitting there. So anyway, but the contact tracing, unless he can absolutely rule it in emphatically, don't bring them into the bucket. It's too iffy. You know, they at UPM, we're being way more strict than they are at UPMC with how they do it. So
again, we have been given flow charts of how to do that and what to do.
And I think we want to tell them their flow charts are nice, but we have other instances of medical professionals that are not being that rigid, and we're going to go with perhaps a more flexible approach. And again, to me,
will someone create that for us if that's what we're supposed to be doing? Will that be created?
I mean, if Dan can't prove it, if he can't define that they were there 15 minutes within 6 feet, and it isn't unequivocal, leave them out. Because if they're all masked, just leave them out. It doesn't make any sense. Our masks are our savior, so to speak. So
like we're making Christina's job a whole lot harder by us taking on the role of the decision makers, versus being able to call the Department of Health and the experts to help decide through each individual circumstance.
Well, I think they're 150.
Changing the rules.
I think they're 150 is crazy. There's just, you would not see that at UPMC. And I know that because
150 what?
150 contacts that now have to be out of school. You wouldn't see it.
They're impact in the hallways too. You know, I'm at Penn College and the college students can be quarantined. We are at 6 feet apart. We are socially distanced. We're wearing face masks. We're not jam-packed like the students in the high school and the middle school are. That's
and we all know what college kids do after hours. Look, Dottie,
well, yeah,
I think this, unless Dan can unequivocally say that, yes, it is very provable, they were within 6 feet for 15 minutes continuous. I don't want to see him racking his brain.
Right, but Dan has to do what he feels comfortable doing. He's signing off on something. We can't tell him, if you can't prove it, don't report it, because that's his ethics and his job. Now, what the Department of Health is telling him to report is a contact tracing. We have to let him follow those guidelines.
So he's making estimates on, I think this might have been within 15 minutes. Probably that one was. And what I'm saying is flip it around. Say, unless you unequivocally know, don't.
I don't want to put that emphasis on Dan. I want Dan to do what he feels comfortable doing.
Well, now he's making judgment calls on kids all the time, and he isn't 100% sure that indeed they were 15 minutes within 6 feet.
But then
and I'm saying is,
doesn't get
you don't know it,
notified
don't
and
sweat
something
it.
happens, that's bad. I mean,
What? What's that?
if that family doesn't get notified that their kid was at risk. So again, I guess you have to weigh the inconvenience of being unnecessarily quarantined with you don't get notified that your kid might have been a significant contact for that person. And then, you know, your kid ends up getting it and infecting the whole family or whatever.
Well, I told you about a scenario where no one got anything. And we didn't have masks and we were well under 6 feet. So I'm telling you about my anecdotal experience is if you got masks on and you're there for 6 or 8 minutes and you're about 5.5 or 4 feet, I mean, why even think about it? Move on. So unless he can prove it, dismiss it. Because right now we're not doing that. Right now we think so let's put them in the bucket. And now we've got 150 kids. And I don't know that's the right way to do it.
I agree with you. That isn't the right way. How can you send perfectly healthy kids home? I don't think that's right.
It's a very big if. To me, it's a big if.
You know, right now it is 12:30 and I'm not sure that we're getting anywhere. This is a very complicated subject to try to figure out. And Jen has to get up at 4 a.m. to go to work. Can we do what she asked and table this motion for next week?
I'd like to take a vote on the motion.
Okay, take a vote on, well, whatever.
Hey, everyone, first, we need to take a vote on the original amendment proposed by Ron. That goes into his main motion. If there is going to be a motion to table or postpone consideration to Ron's main motion with the amendments, then the board can entertain that motion at that time, but we need to address the amendment first before we go into that.
Well, we meet next Wednesday.
The 4th. We have a few things on the 4th, yes.
So why don't we pick it up then?
I don't think it can wait till then.
No, Dave, I don't understand why we're not making a motion tonight to resume school on Thursday. I don't understand why we're not making a motion tonight to resume school on Thursday and extracurricular, everything back in place beginning Thursday. Use tomorrow as a cleanup day at the high school.
Dale, if my
If you wanna
motion
table
passed,
this thing,
if my motion would pass, it would automatically go back on Thursday. Because
we
the
seem hung up on the
parameters change.
2%, Ron.
Oh,
Yeah.
all we gotta do is
but
vote.
if we can't agree on the parameters,
Well, I like the 2%, Ron. It's just, I just want to make sure we've made it clear, because I think your motion needs a little bit more, because we're essentially tweaking what Department of Health and PDE, the matrix they've given, we're tweaking that and applying a new one to our district. And so I think we need to have those parameters pretty well defined so that the administration isn't thinking, what the heck were they talking about? So we got 2%. That's a good number. I assume we'll round it up. 2% rounded up.
and we are still staying in the parameters of the recommendations by the Pennsylvania Department of Education. We didn't exceed it.
But that's changing our whole policy. I almost like Dale's idea. Like, I mean, I would vote to go back Monday and resume all sports this week. You know what I mean? But as opposed to changing the whole policy.
I think you have to change the policy in order to allow the sports.
The athletic policy, at least, right?
Go to the low risk and follow those guidelines, just like we decided to follow the guidelines for substantial risk before we would make our kids not go hybrid or back to school. So we just changed the risk stature.
Right. So Dottie, I think what everybody is saying is instead of using 2 to 4, we're going to use percentages that range from 2 to 5.
I think Ron fixed it, he capped it at 2%.
Yes.
I'm talking about percentage, which is a lot more students.
Okay. So no range, just 2%.
Correct.
So when we accumulate 2% for the 14 days, then we basically have to have an emergency meeting.
Well, I think if we do the 2% for 14 days, that would be, the administration would automatically, there wouldn't have to be another meeting.
Nope, that's
No,
not gonna fly.
No, got to have a meeting.
Well, you do, wait. The administration's doing it now at the 2. So
We're following a state agency's guidelines that have epidemiologists and other people behind it. If we're creating our own rules, we need to get back to us all making that decision together then when it comes down to it.
that's fine, but the 2% is within them guidelines also.
Yep, I have no problem with the 2%, Ron.
And for clarification, that's 2% per building.
Correct.
Okay.
So Ron, the 2%, then we would, so we're
Go ahead, Dave.
we're I guess with that one column in the blue, where it has a 2 to 4 or less than 5%, we effectively are changing that to 2%, just a flat 2%. All the other stuff gets out of that column. It's 2%. Number of cases of COVID-19 with a 14-day period, 2%. And then we're in the moderate window. And so that's how we'll act upon it, because we're in the moderate window, right? So close schools 5 to 7 days. I prefer 5 days, not 7 myself, but and then the cleaning. So okay. Christina, how, I mean, have we defined this adequately right now, or what more do you need from us?
I don't think that I actually can define it because it's defined by the case types that we receive. So again, I think it will just be a necessity to come back and make sure that we're all on the same page. When a decision is made, we're all on the same page, and it's we pinpoint what part of the policy we're using.
Hey,
So it
Dave.
makes it clear.
David Scott.
Yes, sir.
Way back along like 5 hours ago, I think somebody said about taking the monkey off the administration's back. And I think, you know, we call meetings when we need to, and we come, and if we need to vote on things, we need to vote on things. So I think we need to keep it off of their back. And I think exactly what we're doing here. We're willing to come forward and make decisions and take it off their back.
Okay, yep. Yep. All right, so Tom, how do we deal with Ron's amendment here? We need to vote on his amendment, right?
All right, so we have his amendment that essentially changes or amends his main motion. So you would just do the motion to amend, and you already got the second, so you would just have your vote. And then if the vote carries, and from there, if there's a motion to table or postpone consideration, then that can be addressed at that point as well, because then it speaks to the main motion. Does that make sense?
I think, but we've got a motion. Do we have a second on Ron's 2% amendment?
Second. I think we did.
Okay.
Yes.
All right, then all in favor say aye.
Excuse me, Dave.
Oh, yes.
Excuse me. I'm
Yes,
sorry.
sir.
Could we do a roll call vote?
Sure, yeah.
Just for, you know, clarification to the public.
Yeah, well, you can watch the video.
Thank you.
Look, yeah, 5 hours and 40 minutes into the video, yeah.
Okay, so we are voting on the motion with the amendment, correct?
No, the amendment.
Oh, just the amendment.
The 2% amendment.
Okay. Mr. Albert,
Yes.
Dr. Barry,
Yes.
Mr. Kunkel,
Yes.
Mrs. Marriott,
No.
Dr. Mathers,
No.
Mr. Ruffing,
Yes.
Mr. Schimmel,
Yes.
Mr. Snell,
Yes.
Mr. Ulmer.
Mr. Ulmer, yes.
So now we have the motion, original motion of increasing the number to 2%. So now we voting on that, right?
Original motion with the amendment, correct?
Yeah.
Yeah, that's correct. So,
Okay, all right. Do, well, roll call vote again, Brandy.
Mr. Albert,
Yes.
Dr. Berry,
Yes.
Mr. Kunkel,
Yes.
Mrs. Marriott,
No.
Dr. Mathers,
No.
Mr. Ruffing,
Yes.
Mr. Schimmel,
Yes.
Mr. Snell,
Yes.
Mr. Ulmer.
Mr. Ulmer, yes.
Okay, so the motion passes now. So we've effectively, I guess, modified our health plan in a sense. We've effectively put tighter parameters on that rubric that the state gives us.
Not tighter, wider.
Yeah, well, yeah, I mean, the starting point is further down the road than it is right now. All right, implications of when we go back. I mean, we could leave it as is, or we could move that return date. I kind of like what Sue said. Let's return on Monday for in class. But
why?
And let the sports resume on the weekend.
well, let's take one thing at a time, because we'll have a little more discussion on the sports thing too. It's not exactly a clear cut one either. So
Let Jen go to sleep.
so when do you want the kids
Why
to
not
return?
return?
I have to go. I've got 5 and 6 year olds to teach in the morning, and I'm being observed tomorrow. So
Oh my.
this is
geez.
a late night for me.
Yes.
Good luck, Jen,
All right,
tomorrow.
Jen.
Thanks. Bye.
I don't understand why we're not returning sooner.
Well, it's
I don't see why we did. Why not Thursday? I understand Wednesday's out of the question, but why not Thursday?
I'll make a
I don't
motion
see
to
why kids
return.
have to be out of school.
I'll make a
I think we
motion to
need to
return to
shift it.
school Thursday.
And I would
Do I get a
second
I'll
that.
second the
all
motion.
right. We have a motion on the floor by Ron to return Thursday. Dale, you second that?
I second it.
Oh,
Yeah.
Ron, Bill seconded.
Why do we even have a health and safety plan, guys? This is absolutely ridiculous. We have it, and all of a sudden we have to close for a few days to clean the school, and you're totally ignoring the plan and changing it to meet your needs. This is absolutely ridiculous.
No,
No,
it's
no,
getting
it's not,
changed
Dottie.
to meet the
It's called common
students' needs.
sense. It's common sense.
It's to meet the students' needs. They are hurting. They are getting left behind.
And I agree to go back full time, but we also have to look at the health and safety. And I think that you're all thinking that you're all better than epidemiologists. I'm sorry, I better shut.
No, you're staying within the state guidelines. Are you not?
Correct.
Yes, we are.
Well, help me understand about the cleaning. Joe Nafa's not on here, is he? But I mean, if there's a positive COVID case and more cleaning needs to be done than just is done typically on the night, I would rather send the kids back to the building when it's been properly cleaned and sanitized.
It has also been, I forget which organization, CDC, PDE, DHO, I forget which organization told us, when you do have positive cases, you are supposed to let it sit for a day. Then the staff is supposed to go in, do deep cleanings, And then they are supposed to be changing filters, which also takes time, which we promised we would be doing so that all students coming back into that building would have a safe environment. So if that's changing, we need to also let Joe know that he does not have 24 hours to do that as a let it sit, because we're probably going to disagree on that too. Then his staff has to just come in immediately and do those things and have it done, including a filter swap out.
No, Monday's the earliest. I mean, we thought it was going to be longer. Let's do it properly and give our people time to clean the building. You know, we're changing the policy to be more lenient in the future.
And I can agree with Monday.
And I disagree. And I think the kids need to be back in school as soon as we can get them back in there. I said it earlier, I'll say it again. The precautions are doing more damage, actual real damage. You heard it tonight, Dottie. You heard the people, you heard the parents talking. Well, what's our job? Our job is to represent them, and they have told us what they want. And our job is also to use common sense. And that's what I'm doing. I'm using common sense.
I think we need to see where all of these contact tracing goes. I think we need to see if we're having more cases. I don't think we need to jump right back on the bandwagon and open that school up on Thursday. The kids can get 2 days of remote learning. That's not going to kill them. I want them back in school, but I want them back in school safely. So
well, and you're right. It is a 24-hour wait. I mean, I don't want to send all our custodians in there if it's supposed to be sitting for 24 hours before people enter the building to do the cleaning.
I don't understand the sitting for 24 hours. Maybe somebody
Ron,
can
I don't
explain
make
that
up
to
those
me.
rules, Ron. I don't make them up. That's what we
Oh,
were
I
told.
realize
I
that.
think it's because it can
I
stay on
realize that,
surfaces.
Christina, but let
It
me
can stay
let
on
me finish,
surfaces
Sue.
that long.
Let me finish, Sue. I don't understand that. And I know that you didn't make that up, Christina. So don't think that I thought that. But I don't understand it because if we are going through every room and misting the machine, if we are every night to make sure if there's any COVID present that it's taken care of, then why do they have the wait on 24 hours before you can go in and deep clean? I don't understand that.
I think because the COVID's confirmed, because the misting is like a precautionary, but when it's confirmed, it needs additional procedures, correct?
But the misting's supposed to take care of the COVID. That's why it's done.
We have other procedures. We would, instead of just misting and making sure that we're going through very thoroughly with that, we would include additional procedures. And those additional procedures in the wood shop and the tech shops, that would be a lot. To be doing a deep cleaning in those areas for Joe's staff, it will take them some time. Plus, you're also, again, going back through, and we promised the community, which is part of our health plan, that when we had a known case, we would be changing filters, and we would change those as many times as we had the cases, which now I would assume would be the 2% within the 14 days. They would be changing those within that time frame. So that too takes them a while to do. We only have so many people, and we would, Joe would pull all hands on deck to make sure that that would happen. But especially in an area like one of the wood shops or in a technical area, there's a lot of equipment in there.
But the deep cleaning would only need to be done in the areas where the affected subject was. It wouldn't be a deep cleaning of the whole school.
That would be correct. We just have to remember there's 9 periods in a day. There's hallways that the persons have walked through and been through. I am sure that they would want to do some more things in that building in particular. And especially as we move to the 2%, I hope that we really do give them some consideration on the time that they have to clean the building.
Christina,
Yeah,
you or Dan maybe can answer this question. So the cases that were confirmed and the cases that were identified as trace, were they today or yesterday? Were they sent home yesterday?
one goes back 48 hours to last Thursday. One goes back to yesterday. Two go back to yesterday, excuse me.
So if we were looking at 24 hours, and
Well, it's 24 hours from the time that we shut things down for us. So that would have been today in
so
this
it has
case.
nothing to do with when they were on the property last.
If we knew, for example, if we knew that they were on the property that day and had tested positive, generally what happens there is exactly what we see. They leave school, they get a test, they don't return to school, and until we know that they're a positive, we don't do anything out of the norm that we're normally doing.
Right.
So at that point in time, when we do know it's a positive, then that's what they're saying, shut it down. I know, as I say it, it doesn't even make sense to me sometimes, but that's what they're saying. And
So-
I say so much is needed to be done at that point. We just make sure, let's make sure that we give them the time to do that.
Right. And my thing was, if they were at the building at noon yesterday, would it start then? If they left the building at noon yesterday?
Yes, yes.
So,
yes.
So do we know what time the cases left the building yesterday?
One left in the afternoon as a regular student
So
would.
So the 24 hours is up now, is what you're telling me.
I don't know that I have that answer, Scott.
I'm just thinking if we can get into the building tomorrow, because we're saying 24 hours, it needs to sit.
Yep.
Well, it sat.
Yep.
By tomorrow morning, it'll be definitely 24 hours. Could we?
I would have to clarify that they mean 24 hours after the last student leaves. I don't know, sitting here
And
without that in front of me.
You don't know that there weren't any positive students in the school today from that contact. So it would have to go from the time the students left today.
Well, yeah, I just think we need to maybe clarify, because if we could clean the building tomorrow, get a deep clean.
Oh, we'll definitely be cleaning buildings. And I think, and I won't speak for Joe. God love him. I know he's probably.
Joe could be thrown on. It's 1 o'clock. He can be, let's wake him. So.
No, I will not do that.
So will you send custodians into the building even though it's not sat for 24 hours?
I would want him to answer that. If I were Joe, in my mind, I would probably be sending them to all of the other buildings to help get all of that done so that if he's waiting the 24 hours, then more people are available. But again, I don't want to put that out there because I don't know if that's true.
I'm just trying to think through the schedule of cleaning. So, okay.
Right.
And Scott, I agree with you. I think that if the last person was the last subject that was tested positive, left the building 24 hours from now, or before right now, that 24-hour period would be up, because you can't rely on contact tracing to start your 24 hours, or you're gonna need to have 150 people tested in order to start that 24 hours. So, and just to clarify, Scott, I realize it's after midnight, so as you keep saying tomorrow, which is actually today, that they could start cleaning because it'd be past the 24 hours.
Isn't the question really, how much time do they need to essentially do the effective cleaning that we're saying they should do? What day does that put us into? Are they back on Friday? Are they back on Thursday? Or are they back on Monday?
I can't answer that without Joe being here.
They would have a whole day today. And like I said, they don't have to deep clean the whole high school. They have to deep clean where the affected subjects.
It takes
work.
them several days to do filters. I do know that. And I don't know how many filters the high school has. I can't even venture a guess. I just know it's very expensive to do, but we promised that that's one of the things that we would do to make sure that the air quality was good in all of our buildings that way.
All right, well, then, I mean, it looks like we're finished discussing. We got a motion on the floor. It's return Thursday. My only concern for Thursday is that maybe a day too soon for the cleaning we want to do. Yeah, that's my only concern. They'll end up having to do it over the weekend, I guess, if we run them back in there too soon, so.
But does Friday I mean, could we bring them back Friday? I realize it's the end of the week, but it's another day they're in school.
Yeah, no, I agree, Scott. I agree.
Where does that put us for sporting events?
Well, that's another topic. Let's get them back in school, then we'll talk. Well, these aren't tied together though, Bill. I mean, who made the motion? Ron, did you?
Yes.
Would you be willing to withdraw it and make it Friday instead of Thursday?
Yes.
Okay.
I'll withdraw it, and
I don't understand why. We've already
Because
gone
I
a
asked
couple of
them
days
to.
without filters being changed.
Because I want to get this voted on.
No, that's not why I decided to agree to change it. I agreed to change it so we could make sure the deep cleaning was done, since it seems that it would take 2 days to do it.
Yeah, okay.
I do think that Joe will be very appreciative of that, and he will, as you know, make sure that everything is tip top.
Okay. We have a second on Ron's Friday motion.
You don't need a second to withdraw the motion.
No, I mean, he's actually making the Friday motion.
Okay, so that's the motion. Okay, I just want to make sure.
Okay, thanks. No
But
second on that.
I'll second. I'll
Okay.
second it.
All right. All in favor of returning on Friday, say aye. Aye.
Aye.
Aye.
Opposed?
No.
No.
Okay. Ayes have it 6-2. Okay. Sports. Looks like the core of the issue comes down to, can we represent to the PIAA that with a reasonable confidence level that we believe that our teams are COVID-free? We have to, in some form or fashion, go out on that limb. That's what I'm thinking is the core issue.
But with Dan's careful contract tracing, right? So any of the 150 are excluded from the participation. And we think, if anything, he was overly zealous about who's considered a contact.
Yeah, you can't.
I mean, just to make sure I'm clear.
I'm going to answer for him. I don't know if he's still here. If he's still here, he'll interrupt me and tell me. But the only thing that I believe that could have been looked at as he explained it broadly was a shop class. So the other pieces, as he explained to you, when a student has 6 students in a room and has 9 periods a day that could be close contact, that would be 45. So if I look at what was said at face value, that would mean that there are potentials maybe in a shop class, but again, I don't know what those numbers would ferret
Well,
out to.
Based on the discussion tonight, I'm taking all the shop kids off because I can't tell you yes or no.
Okay.
Is that correct? Is that correct?
You're taking them off the list, Dan?
Is that correct? Yeah,
Yeah, they're taking them out of the 150.
taking all the shop classes out, even though there could have been.
If you can't nail that down, I don't, we're messing with too many lives, and we just don't know. And it just seems to me there's an unlikeliness, an uncertainty, a doubtfulness that there was adequate or sufficient contact times. And
But could the families be informed so that they could voluntarily quarantine their kid if they chose to, especially if there's other vulnerable family members? Like, you know what I mean? Like, rather than forcing the 14-day quarantine, could they at least be informed and quarantine if they choose to?
I agree, Sue. I think that that's a good, and Dan, I don't think there was an official vote saying yes or no to that, but you know, you need to do what you feel comfortable doing.
Well, frankly, I'm not comfortable doing any of it. It was supposed to be done for us, but
yeah.
I'm not a contact tracer. So,
Hey, Dan.
Yeah.
It's Scott. So earlier in the evening, you spoke about you guys have to basically justify symptom or case free. And you said symptoms. Is that correct?
Yep.
So if somebody doesn't have a fever, a cough, whatever,
standard list. Yeah.
So they are clear to play.
Correct.
Is that correct?
Yep.
So is the question, you've been tested? Is that a question?
Question is, have you been in close contact with somebody with COVID-19?
Okay.
That's the hang up. That's the hang up.
Maybe it's the doctors. Okay.
Yeah. So I can't.
I get that. But
in
other
those
symptoms.
shops, I'm not clear. So how do I?
Right. But you were, and I'm going to use football as an example. You said there's 16 or 18 kids, 20 kids on the football team.
Well,
that
17 and 3 more from this new case, so 20.
Right. And there's 70 some kids on the football team.
There's
Is that
62.
Is that a number or whatever?
62.
Okay. And I heard other people say the Warriors are willing to take the field with whatever we have. So
Yep.
all those other 56 people would have the symptoms questions asked, and as long as they pass the symptoms test or questions, they're good to go. Is that my understanding that correctly?
Yep.
And that would apply to soccer, to track, to tennis, whatever.
Correct.
Okay. So, and again, I'm in agreement that not to punish everybody for a few that, sad to say, were either in contact or have become a case. So I just want to be sure that I'm understanding the symptoms question and not necessarily a COVID test or something like that. Because a lot of people are saying if they get COVID tested, they can play this weekend. Well, I don't think that's the case.
Well, again, that's the ultimate solution in this. If we could get the
Right.
rapid testing going,
Right.
we could test every kid. I mean, some of those tests are 15-minute tests.
Right.
We could get them tested before they even board a bus or take the field. And
Then they would be okay.
There isn't a question.
Right.
Okay.
So if the parents could help out by getting the kid to CVS and doing that, that would ease your mind.
That's for
obviously.
parents that can afford to do that, that have the luxury of taking them and affording the test. And it's just not, again, if the school district was provided the testing, we could keep it running a lot easier.
Dan, how many of the kids from that you're saying you're gonna take off from the shop area would be back on as far as the football team is concerned?
I'd have to pull that list. I don't know that number.
Dan, if the questions that Scott asked you, that would that, and that wouldn't include the ones that were in close contact, because of course they couldn't answer no to that question. But for the ones that could answer the questions, would that give you confidence to certify that for those players that the team is COVID free?
Would that give me confidence? No, that would not give me confidence. The only thing that would give me confidence would be tests for the kids.
Oh yeah, I realize that, but I'm trying to get a handle on whether you would, because ultimately it's up to you to let the PIAA know that you have well students to play, correct?
Yes.
And when I said about confidence, I realized that we all would be more confident if the testing, if every student and faculty member in our district could get tests whenever they wanted to, and that they were readily available. But when I asked you if you'd be comfortable, I was more or less asking you, would you be sending the PIAA verification that, or confirmation that you are certain that our team is a well team? I'll put it that way.
I would be confident if we did not have cases of positive cases of COVID. That confidence is a little bit shaken right now on what we have floating around and with who has it. But I will do what whatever is decided tonight.
Dan, when I was talking earlier about my perspective on how to view the contact tracing and the confirmation of it, I can tell you it was not a backwards look. And it was not, in no way is it meant to be a slight on anything you've done at all. I'm looking forward looking on that. So I don't really expect that anything we've done to date would change, because we've already turned that information over to Department of Health. So it's, to me, that's a done deal. I'm thinking in terms of from midnight today going forward, a new way of thinking about the contact tracing. So we have what we have, and I don't really expect that to be changed.
No, I didn't take it as a slight, but then to advocate for the current situation, why penalize this group? Again, you look at all the other reasons that we're even having this discussion, is the importance of athletics, the fact that it's a playoff game, could be the last game. The list goes on. Why then penalize because of following the guidelines that we were provided? If we're going to change them in the future, maybe we should take a look back then.
Okay. Yeah, no, that's fair.
I didn't take it as a slight or anything. I was doing my job with what was given to me by experts, and I can easily call Department of Health and say, look, it was a mistake. I misinterpreted the contact tracing at the direction of the board. So,
Dan, I just want to say, and I want you to know that I agree with you that a big burden's been put on your shoulder with this contact tracing. It's just another example of what our government has done to us the same thing that they did to us with the Safe to Say program. They dumped it all on us instead of taking responsibility on their own. And I really do appreciate the job you're doing. And to be honest with you, I feel sorry for you because you shouldn't have to be doing it.
Well, thanks, Ron.
So Dan, what do you need from us that, you know, gives you that confidence, comfort that, you know, to be able to say, you know, I can live with what we got going on here. I can live with
I need a
putting our
directive
teams in
from
the
the
field.
board. I would need a directive. I would need a directive from the board.
Well, is there a way? And I guess I'm asking Christina or Tom, is there a way for the board to essentially authorize that quote unquote certification? That we would approve, you know, what's the right term they use, Dan? What are those forms?
I think they're just the COVID certification forms.
I mean, for the board, it's we've seen how diligent Dan is. We've heard about the sports teams and what they're doing, and we know that we've eliminated a number of players from programs because of contact tracing and likely problems. You know, are we as a board confident that we've done? You know, we've put in place things that we can say, you know, to our administration that we're confident what you've done. We authorize you to sign that, and basically we own that.
Well, and then Dan's done due diligence. I mean, if all the people who've been verified within the 6 feet for 15 minutes are excluded from participation, then yeah, I think that to our best ability to say the rest of the kids are okay.
Yeah, Dan, do they do a temperature check at game day?
We do that.
Okay.
Our coaches do that.
In the evening?
Yep, when the kids come in, they go through the screening and the check the temperature.
Okay.
But the hang up is the question on how do they answer, have you been in contact with anyone who contracted COVID in the last 10 to 14 days?
Yeah.
So.
Is that an automatic, you're out of there default kind of a thing?
Yep.
Well, if it didn't include the contact tracing subjects, they could answer no to that, correct, Dan?
Correct.
And I think that's where Sue was going with her comment on not penalizing all the kids for and through no fault of their own, the ones that have been identified through contact tracing.
Tom, would a motion such as on behalf of the board, we authorize Dan Taormina to certify that based on our, well, just to certify that our sports teams are well, whatever the right wording is, well to play in the upcoming sporting events this weekend or something to that effect?
I think I would prefer that my name's not in that motion and just that the board authorizes
Okay. Yeah.
the participation of our teams.
And that, right, to the best of our knowledge.
All right.
Anyone with.
Okay, then.
And I would say, Dave, you know, just going on that, you know, just something to the effect of, you know, the board has heard, you know, from, you know, relevant administrative staff, and they basically authorize administration to make the pronouncements.
Well, I disagree with that. I disagree with that. Dan just said he didn't want his name on it. Why would we go back to saying it's administration again?
Okay, well, we don't have to. I was just.
Thank you.
Yeah, I'm sorry. I just don't want to take a chance on my certificate.
Gotcha.
I think the district is better off with me still being around than losing my certificate.